Hello and welcome back to Learning English Pro. My name is Jer, your online tutor and guide. I'm delighted to bring you this English lesson where you'll learn 100 English phrases for nursing. These phrases are essential for daily interactions with patients, doctors, and other healthcare professionals. So whether you're a beginner or have some experience, this lesson is designed to enhance your communication skills in a medical setting. If you want to follow along or revise the phrases after the lesson, I've included a full list of them in the video description. In this lesson, we'll cover 100 useful phrases divided into topics such as patient admission, taking vital signs, medication administration, patient care, wound care, patient education, communication with doctors, emergency situations, and discharge instructions. These phrases will help you navigate various scenarios with confidence and clarity. But that's not all. At the end of this lesson, I've included additional resources to further your learning, like my lesson on types of nurses in English, where you'll learn about the different types of nurses and their roles in the healthcare system. After that, we will dive into Beginner's English, a medical masterclass, which is a comprehensive lesson from my channel designed for those who are starting their journey in medical English. And this extensive lesson will finish up with Advanced Medical English Masterclass. This is for those who want to take their medical English skills to the next level. This advanced lesson covers more complex topics and vocabulary. Along with today's lesson on English phrases, these additional lessons are perfect for expanding your knowledge and improving your proficiency in medical English. So let's get started. Grab your notebooks and let's dive into today's lesson. Remember, practice makes perfect, and I'm here to support you every step of the way. And our first topic is patient admission. Welcome to our facility. How are you feeling today? Welcome to our facility. How are you feeling today? Can you please fill out this form? Can you please fill out this form? Do you have any allergies? Do you have any allergies? What brings you here today? What brings you here today? Can you describe your symptoms? Can you describe your symptoms? Do you have any existing medical conditions? Do you have any existing medical conditions? Are you currently taking any medications? Are you currently taking any medications? Have you been hospitalized before? Have you been hospitalized before? We need to take your vital signs. We need to take your vital signs. Please provide a sample of your urine. Please provide a sample of your urine. Well done, that's 10 phrases learnt already for the world of nursing. Next up, let's take a look at some phrases relating to taking a patient's vital signs. I need to take your blood pressure. I need to take your blood pressure. Please roll up your sleeve. Please roll up your sleeve. I'm going to check your temperature. I'm going to check your temperature. Let me measure your pulse. Let me measure your pulse. I need to listen to your heart and lungs. I need to listen to your heart and lungs. Please breathe in and out slowly. Please breathe in and out slowly. Your vital signs are normal. Your vital signs are normal. Your blood pressure is a bit high. Your blood pressure is a bit high. Your temperature is elevated. Your temperature is elevated. I need to record your oxygen levels. I need to record your oxygen levels. Now it's time to move on to our third topic, which is medication administration. It's time for your medication. It's time for your medication. Have you taken this medication before? Have you taken this medication before? Please take this pill with water. Please take this pill with water. Do you have any difficulty swallowing pills? Do you have any difficulty swallowing pills? This injection might sting a bit. This injection might sting a bit. I'll need to give you an IV. I'll need to give you an IV. Are you experiencing any side effects? Are you experiencing any side effects? This medication should help with your pain. This medication should help with your pain. Make sure to take this with food. Make sure to take this with food. Let me know if you feel any discomfort. Let me know if you feel any discomfort. It's time to move on to our next topic, which is patient care. How are you feeling today? How are you feeling today? Do you need help with anything? Do you need help with anything? Are you in any pain? Are you in any pain? Can you rate your pain on a scale from 1 to 10? Can you rate your pain on a scale from 1 to 10? Let me help you sit up. Let me help you sit up. I will assist you to the bathroom. I will assist you to the bathroom. Do you need help changing your clothes? Do you need help changing your clothes? Let me adjust your pillow. Let me adjust your pillow. Would you like a blanket? Would you like a blanket? Can I get you anything to drink? Can I get you anything to drink? We are already on our fifth topic, wound care. I need to change your dressing. I need to change your dressing. This might hurt a little. This might hurt a little. I'm going to clean the wound now. I'm going to clean the wound now. We need to keep this area dry. We need to keep this area dry. Please try not to touch the wound. Please try not to touch the wound. The wound is healing nicely. The wound is healing nicely. I'm going to apply some antibiotic ointment. I'm going to apply some antibiotic ointment. You may feel a bit of pressure. You may feel a bit of pressure. I will bandage this up for you. I will bandage this up for you. Let me know if it starts bleeding again. Let me know if it starts bleeding again. We are halfway through our English lesson on phrases for nurses. Next up, our topic is patient education. It's important to take your medications as prescribed. It's important to take your medications as prescribed. You need to follow a low-sodium diet. You need to follow a low-sodium diet. Regular exercise is beneficial for your health. Regular exercise is beneficial for your health. Make sure to stay hydrated. Make sure to stay hydrated. Here's how to manage your condition at home. Here's how to manage your condition at home. Always wash your hands before eating. Always wash your hands before eating. Avoid smoking and excessive alcohol consumption. Avoid smoking and excessive alcohol consumption. Monitor your blood sugar levels regularly. Monitor your blood sugar levels regularly. This pamphlet contains useful information. This pamphlet contains useful information. If you have any questions, don't hesitate to ask. If you have any questions, don't hesitate to ask. Our seventh topic is communication with doctors. I need to update the doctor on your condition. I need to update the doctor on your condition. The doctor will be in to see you shortly. The doctor will be in to see you shortly. Let me check with the doctor about that. Let me check with the doctor about that. The doctor has prescribed a new medication for you. The doctor has prescribed a new medication for you. I need to report this symptom to the doctor. I need to report this symptom to the doctor. The doctor has ordered some tests. The doctor has ordered some tests. I will consult with the doctor about your treatment. I will consult with the doctor about your treatment. The doctor has requested a follow-up appointment. The doctor has requested a follow-up appointment. I'll inform the doctor about your pain. I'll inform the doctor about your pain. The doctor will review your test results. The doctor will review your test results. In our next topic, we will take a look at phrases you can use in an emergency situation. We need to act quickly. We need to act quickly. Stay calm, we are here to help. Stay calm, we are here to help. Call for emergency assistance. Call for emergency assistance. I need to check your vital signs immediately. I need to check your vital signs immediately. Please follow my instructions. Please follow my instructions. Are you experiencing chest pain? Are you experiencing chest pain? We need to start CPR. We need to start CPR. The defibrillator is on its way. The defibrillator is on its way. I need to stabilize you before the doctor arrives. I need to stabilize you before the doctor arrives. You are in good hands. You are in good hands. Let's move on to our penultimate topic, discharge instructions. You are ready to be discharged. You are ready to be discharged. Here are your discharge papers. Here are your discharge papers. Make sure to follow up with your primary care physician. Make sure to follow up with your primary care physician. These are your home care instructions. These are your home care instructions. Take your medication as directed. Take your medication as directed. Schedule a follow-up appointment. Schedule a follow-up appointment. If you experience any complications, contact us immediately. If you experience any complications, contact us immediately. Keep the wound clean and dry. Keep the wound clean and dry. Avoid strenuous activities. Avoid strenuous activities. Thank you for choosing our facility. Thank you for choosing our facility. It's time to move on to our final topic for this lesson, general courtesy. How can I assist you today? How can I assist you today? Please let me know if you need anything. Please let me know if you need anything. I'm here to help you. I'm here to help you. Your comfort is our priority. Your comfort is our priority. Thank you for your patience. Thank you for your patience. I appreciate your cooperation. I appreciate your cooperation. We aim to provide the best care possible. We aim to provide the best care possible. Feel free to ask any questions. Feel free to ask any questions. I will be with you shortly. I will be with you shortly. Have a great day. Have a great day. Well done, you've learned 100 new phrases. These phrases should help nurses in their daily interactions and ensure clear, effective communication with patients, doctors, and other healthcare staff. And don't go anywhere because our next lesson is coming right up, Nurse Types in English. And this lesson will be followed by 2 English masterclasses on the medical world. So buckle up because you're about to learn even more medical English. Today we're delving into a captivating topic that bridges languages and cultures, nursing roles. As we navigate through this enlightening journey, we'll not only explore the array of roles within the healthcare realm, but also unravel the fascinating linguistic differences between American and British English. If you want to follow along with the lesson, all the words covered today are in the video description. Okay, let's get right to it. Our first role is a registered nurse, or abbreviated to RN in the United States, or a registered general nurse in the UK, an RGN. This type of nurse provides direct patient care, administers medications, monitors patients' conditions, and collaborates with doctors to plan and implement treatment. Next up, we have a licensed practical nurse, an LPN, in US English. In UK English, it's called an enrolled nurse, or an EN. This type of nurse assists with patient care, performs basic medical tasks, and monitors patients' vital signs under the supervision of RNs or doctors. A certified nursing assistant, a CNA in US English, or a nursing auxiliary in UK English, provides hands-on care to patients, assisting with activities of daily living such as bathing, feeding, and dressing. A clinical nurse specialist in American English or advanced nurse practitioner in UK English, these are advanced practice nurses who specialise in a specific care like paediatrics or critical care, and they provide expertise in patient care, education and research. In American English, our next role is referred to as a nurse practitioner. In British English, it's called a nurse prescriber. These are advanced practice nurses who can diagnose and treat medical conditions, order tests, and prescribe medications, often working independently. A certified registered nurse anaesthetist in American English, or simply a nurse anaesthetist in UK English, administer anaesthesia to patients who are undergoing surgery, ensuring their comfort and safety during procedures. A certified nurse midwife in the US is simply called a midwife in UK English. They provide care to pregnant women before, during and after childbirth, offering a holistic approach to maternity care. A pediatric nurse in American English is called a children's nurse in UK English. These nurses specialise in caring for infants, children and adolescents, addressing their unique medical and emotional needs. A neonatal nurse is a term used in both US and UK English. These refer to nurses who care for newborns, particularly those born prematurely or with medical complications. And this is usually done in neonatal intensive care units. An oncology nurse in the US may be called a cancer nurse in the UK. These types of nurses specialise in caring for patients with cancer, providing support, administrating treatments, and managing side effects. An emergency room nurse is a general term, and this relates to nurses who work in the fast-paced environment of the emergency room. Their work involves assessing and treating patients with various medical emergencies. Our next term is intensive care unit nurse. Intensive care unit is usually abbreviated to ICU, so this nurse is typically called an ICU nurse. And they care for critically ill patients, monitoring their conditions and administering specialized treatments in intensive care settings. Let's move on to the operating room nurse. These nurses assist surgeons during surgical procedures, ensuring that the operating room environment is sterile and safe. A psychiatric nurse specializes in mental health care, providing support, therapy, and medications to patients with psychiatric disorders. Let's move on to geriatric nurse. Geriatric nurses care for elderly patients, addressing their unique health needs and promoting quality of life in aging populations. A rehabilitation nurse works with patients recovering from injuries or surgeries, helping them regain mobility and their independence. Our next nurse role is the community health nurse. Community health nurses provide care and education to individuals and families within communities, focusing on preventative care and health promotion. School nurses care for students' health and well-being, managing medical needs and promoting a healthy school environment. A hospice nurse or a palliative care nurse provide compassionate care to those who are terminally ill and their families, focusing on comfort and quality of life. And last but not least is the travel nurse. Travel nurses work on short-term assignments in various healthcare settings, often moving between hospitals or regions to address staffing needs. When thinking about all these different types of nursing roles, remember that the roles and responsibilities of nurses can vary based on factors such as education, training, certifications, and specialization. And there you have it, a glimpse into the remarkable tapestry of nursing roles, each contributing a unique thread to the fabric of healthcare. Whether it's a comforting presence at the bedside, a steady hand in the operating room, or a guiding light in a community, nurses are the heart and soul of the medical field. Thanks for joining me on this exploration of nursing roles. If you found this video informative and engaging, remember to give it a thumbs up, subscribe to my channel Learning English Pro for more insightful content. I've published a huge array of medical related vocabulary videos, so make sure to check those out on my channel page. That just leaves me to say I hope you have a fantastic day, and remember, keep learning English like a pro. Welcome to the Ultimate Beginner's Guide to Medical English, where we unlock the essentials of healthcare communication, starting with today's lesson on basic medical terminology. But that's just the beginning. I've carefully crafted a series of 10 additional lessons covering everything from hospital vocabulary to first aid in English, ensuring you're fully equipped to navigate the medical world with confidence. So after this lesson, stay tuned for all of those additional lessons. Whether you're aspiring to work in healthcare or simply aiming to enhance your English for personal knowledge, these lessons will pave the way for your mastery in medical English. So if you're ready, let's dive into our first topic of basic medical terminology. And firstly, we're going to look at the human body and explore 6 major body systems. Understanding these systems is crucial for anyone looking to master medical English. And for each term in today's lesson, I'll introduce a useful phrase that you might encounter or use in a medical context. The cardiovascular system is a system which circulates blood throughout the body, delivering oxygen and nutrients to tissues. Cardiovascular system. Let's take a look at our example phrase. The patient's cardiovascular system is healthy with no signs of heart disease. Let's move on to our next body system, which is the respiratory system. Repeat after me. Respiratory system. The respiratory system comprises of the lungs and airways. This system is responsible for breathing and gas exchange. She is experiencing difficulty breathing, indicating a possible respiratory system issue. The digestive system is the system which breaks down food into nutrients, which the body uses for energy, growth, and cell repair. Digestive system. Our example phrase is, gastrointestinal symptoms suggest a problem within the digestive system. Next up, we have the nervous system. This system controls both voluntary actions like walking and involuntary actions like breathing. Nervous system. After the accident, we're monitoring him for any signs of nervous system damage. The musculoskeletal system provides support and movement with bones, muscles, tendons, and ligaments. Musculoskeletal system. Let's check out our example phrase. The X-ray shows a fracture in the arm affecting the musculoskeletal system. Our final body system for this segment is the immune system. This system defends against pathogens and disease. Immune system. A weakened immune system can lead to frequent infections. Now that we've covered the body systems, let's move on to understanding common symptoms. This knowledge will help you describe and understand medical conditions more effectively. A fever is an elevated body temperature, typically a sign of infection or illness. Fever. Our example sentence is, Gemma has had a fever for the past few hours. Let's move on to nausea. Repeat after me. Nausea. This is a feeling of unease in the stomach that often comes before vomiting. She started to feel some nausea this morning. Let's move on to headache. A headache is pain or discomfort in the head, scalp, or neck, ranging from mild to severe. Vincent started to get a headache this morning in the library. Our next symptom is dizziness. Dizziness. This is a sensation of spinning or losing one's balance, often linked to inner ear issues or low blood pressure. Let's check out our example phrase. Ming lay down as she was experiencing some dizziness. Fatigue is an overwhelming sense of tiredness or lack of energy, not relieved by rest or sleep. Fatigue. Kate has suffered with extreme fatigue since she had a virus. Next up, we have cough. Repeat after me. Cough. A cough is where we expel air from the lungs with a sudden sharp sound. One of the symptoms Edward had was a bad cough. Navigating the medical world involves interacting with various healthcare professionals, and each plays a unique role in ensuring your health and well-being. Let's explore some of these professions, providing a brief definition and useful phrase for each. First up is a GP or a general practitioner. This is a medical doctor who can diagnose and treat a wide range of common illnesses and health issues. Let's check out our example phrase. You should see a general practitioner if you're experiencing unexplained symptoms like persistent headaches or fatigue. Our next healthcare professional is a nurse. Nurses provide care and support to patients in various settings, assisting with medical procedures and patient education. The nurse will take your vital signs and update your health records before you see the doctor. A pharmacist is an expert in medication. They are responsible for dispensing prescriptions and advising on their safe use. Ask your pharmacist if this medication has any potential interactions with what you're currently taking. A surgeon is a doctor who can perform operations to treat diseases, injuries, or deformities. Let's check out our phrase. The surgeon explained the risks and benefits of the procedure during the consultation. There are lots of types of healthcare professionals. Let's cover one more. A dermatologist. Dermatologists specialize in treating conditions relating to skin, hair, and nails. For persistent skin rashes or acne, you should consult a dermatologist for specialized care. Armed with knowledge about healthcare professionals, it's time to tackle what comes next, treatments and procedures. We're diving into essentials that keep the medical world turning. A prescription is a doctor's order for the preparation and administration of a drug or device for a patient. Our example phrase is, this prescription should help alleviate your symptoms within a few days. Our next medical treatment is a vaccination. This is the administration of a vaccine to help the immune system develop protection from a disease. Vaccinations are crucial for preventing infectious diseases. A surgery is a medical procedure involving an incision with instruments performed to repair damage or arrest disease in a living body. The surgery is scheduled to remove the benign tumor. Physical therapy is a treatment method that uses physical techniques to relieve pain, improve mobility, and restore physical function. Our example phrase is, physical therapy is recommended to recover from the knee injury. Chemotherapy is the use of chemical substances, especially drugs, to treat diseases like cancer by killing or stopping the growth of cancerous cells. Chemotherapy is a common treatment for various types of cancer. A biopsy is the removal of cells or tissues for examination under a microscope to check for illness or disease. A biopsy will be performed to examine the tissue for signs of disease. It's really essential to be prepared for unexpected situations. Moving forward, we're about to explore emergency phrases that are crucial in urgent healthcare settings. Let's get ready to learn how to express urgent medical needs clearly and concisely. I need an ambulance. We would use this phrase in a life-threatening situation that requires immediate medical attention. I need an ambulance. It's an emergency. He's having trouble breathing. This phrase alerts medical personnel to the urgency and nature of the medical crisis. It's an emergency. He's having trouble breathing. I'm allergic to penicillin. It's vital to communicate allergies to avoid adverse reactions in emergency treatment. I'm allergic to penicillin. She's unconscious. This phrase indicates a serious condition requiring urgent medical evaluation. She's unconscious. There's been an accident. You can use this phrase to report incidents requiring emergency medical services. There's been an accident. I think it's a heart attack. This phrase describes symptoms that suggest a heart attack, prompting immediate action. I think it's a heart attack. And that brings this lesson on basic medical terminology to a close, but don't go anywhere. Coming right up is a lesson on hospital vocabulary. First up, let's take a look at some synonyms for the word hospital. We have medical institution, medical facility, health centre, and clinic. Reasons you might go to the hospital include surgery, therapy. You may need to go for testing or an examination. Maybe you need a consultation. A consultation is meeting with an expert, like a specialist medical doctor, in order to seek advice and receive evaluation. If you are a regular patient, you might be going for a checkup. A checkup is an appointment where a disease or illness is monitored. Maybe you are visiting someone in a hospital. In that case, you are called a visitor. Hospitals are divided up into different areas called departments or wards. If you need to find where you're going, you can always ask for help at the help desk or reception. In every ward or department, there will be a nurse's desk where you can seek further information. A lot of people will arrive in hospital because of an emergency. This is a serious, unexpected, and often dangerous situation requiring immediate medical action. And if you have a medical emergency, it's very likely that an ambulance will come to collect you. and bring you to the hospital. The person on the ambulance team who initially evaluates you and checks your health is called a paramedic. And if it is required, you'll be put on a stretcher. This is a mobile bed that is used to carry patients to and from an ambulance. Next up, you are on your way to the emergency room. This is what is called in America, and sometimes it's abbreviated to ER. In other countries, it might be referred to as the emergency department or accident and emergency. Short for accident and emergency is A&E. And when you are being treated in the hospital, you are called a patient. If your treatment involves you staying in hospital, you are called an inpatient. And if you stay at home while receiving your treatment, you are an outpatient. And as an outpatient, usually you would come into the hospital by appointment for your treatment. As a newly arrived patient, you will be subject to an assessment or an examination, and this will be done by a doctor. If you want to learn different types of doctor, check out my vocabulary which covers this topic. The link is on screen and in the description below. A tool which you'll always see a doctor carrying is the stethoscope. This is primarily used to listen to a patient's heartbeat. Doctors are also known for wearing a white coat, and it is not unusual for them to be referred to as a white coat. They can often be seen wearing scrubs. These are blue or green pajama-like clothing that is worn for protection or during surgery. And during surgery, a doctor can be seen wearing a surgical gown, a face mask, protective goggles, and gloves. A very important employee of the hospital is a nurse. If you'd like to learn more words relating to nursing, check out my video on healthcare vocabulary. Nurses provide care to patients, and a big part of their job is managing the patient chart or patient file. Nurses are known for working very hard and doing lots of different tasks, some of which include taking your blood pressure and your body temperature. And more often than not, it will be a nurse who dispenses your medication to you. Synonyms of medication include medicine or drugs. Let's take a moment to look at the different ways medicine is given to you. One method uses a syringe. This is called injection. Medication can be taken orally with pills. Medication can also be given with an IV drip. This is short for intravenous drip. Common types of medication include painkillers, antibiotics, antiviral drugs, or steroids. In the hospital, you may receive a prescription from your doctor for medication. This is a signed document which you can bring to the pharmacy, and they will provide you with your medication. Next up for our hospital vocabulary, let's look at different types of scans. A scan is a testing method, and these include X-ray, along with MRI, which stands for magnetic resonance imaging. There is also the CT scan. CT stands for computerized topography. There is also the ultrasound, which is commonly used during pregnancy. Another common type of test in the hospital is a blood test. Sometimes it'll be referred to as a blood screening. For some conditions, it may be necessary to stay in hospital for a prolonged period. Sometimes this is done for observation or monitoring. Doctors do this to see how you are recovering or how your condition is progressing. If your condition is very serious, you may need to stay in the intensive care unit. And if you are having difficulty breathing, you may be put on oxygen. For some people, staying in hospital involves having surgery. This can be done for diagnosis, for biopsy, or perhaps for removal or repositioning if something is where it shouldn't be. Or perhaps it's to redirect something like blood flow. And of course, we must consider transplants. There are many other reasons for surgery. Can you think of any more? Let me know in the comments. After surgery, it's very common to get bandaging, and this is done, of course, with bandages. These can also be used for things like sprains or small cuts and abrasions. However, if you break or fracture a bone, you may need a plaster cast. This is done to reset the bone. It can simply be referred to as a cast. I got a cast on my broken arm. If you've broken a leg or have difficulty walking, you may need crutches. For someone who needs additional support while walking, they can use a Zimmer frame. This can also be called a walker. If you are unable to walk, you will need a wheelchair. A wheelchair is also commonly used to transport all patients throughout the hospital. A common reason for women to go to hospital is to give birth. This is often done in the maternity or labour ward. Generally, in big cities, there will be a maternity hospital. This type of hospital only takes care of women and their babies. Doctors may also keep you in hospital for convalescence. This means for rest and recovery. This is common after a surgery or after suffering from a serious illness or condition. And when you're ready to leave hospital, the doctor and hospital will discharge you. This is the word we use to describe when the hospital or doctor has given official authorization to release you from medical care and to return to your home. The first piece of medical equipment we'll take a look at is the crutch. Repeat after me. Crutch. When they're given as a pair, they're simply called crutches, the plural form. Our next piece of equipment is called a walker. Repeat after me. Walker. This is typically given to older people who may have mobility issues. And we also have the wheelchair. Repeat after me. Wheelchair. Next up, we have plaster cast. Plaster cast. This can also be referred to as plaster of Paris. Plaster of Paris. More advanced versions of a plaster cast would be called a synthetic cast. Synthetic cast. We also have the splint. Repeat after me. Splint. A splint involves a rigid material supporting and immobilizing a broken bone when it has been set. Common types of splint are the leg splint and finger splint. Similar to a splint, we have a support. Something like a wrist support can help with a fracture or a broken bone when it is healing. For a broken or injured foot, a support boot is often used. This can also be referred to as a brace boot. And next up, we have a brace itself, which is like a bigger version of a splint. Brace. A common version of the brace is the leg brace, but there's also lots more, such as the neck brace as shown on screen, but you can also see sometimes a back brace or even a body brace. A similar device which is used for a broken arm is called a sling. Repeat after me. Sling. Let's move on to our next piece of equipment, which is bandage. Repeat after me. Bandage. There are lots of different types of bandage. This one is called a compression bandage, or sometimes it's called an elastic bandage. Next up, we have dressing. Repeat after me. Dressing. This is a sterile bandage which is applied directly onto a wound. Another type of bandage is called medical gauze. Medical gauze. This is the thin, transparent fabric which is often used along with bandages. We also have adhesive tape and cotton wool. These can be found in lots of other settings than a medical practice. Adhesive tape and cotton wool. A common type of bandage found in the home is referred to as a band-aid in American English, that's a trademark by the way, and as a plaster in UK English. A more general term for it would be an adhesive bandage. Lots of these types of bandages and gauzes can be found in a first aid kit. This can be a piece of medical equipment that can be found in lots of different workplaces and is useful in case of an emergency or an accident. This small medical tool is known as a swab. Repeat after me. Swab. And this is a stethoscope. Let's try it one more time. Stethoscope. For measuring a patient's temperature, we use a thermometer. Thermometer. Another test we can do for a patient is a blood test. Blood test. This is done with a syringe. Repeat after me. Syringe. It is tempting to say syringe, but it's syringe. And this part of the syringe is known as the needle. Needle. Something which is commonly found in lots of different medical settings is a vial. Repeat after me. Vial. And similar to a vial, we have a test tube. Test tube. Moving along, our next piece of equipment is called a blood pressure cuff. Blood pressure cuff. Our next piece of equipment can be known as telemetry pads or ECG electrodes. These are used to monitor important functions in a patient's body. If you've ever broken a bone, you will have had an X-ray. X-ray. This device is placed on the finger and used to measure the amount of oxygen in the blood. It's called a pulse oximeter. Pulse oximeter. To find out how heavy someone is, you would need a weighing scales. Weighing scales. Our next device is used to look at the ear and eardrum. The otoscope. Repeat after me. Otoscope. Let's move along to some more smaller tools, like the tweezers. Repeat after me. Tweezers. We also have the scalpel. Repeat after me. Scalpel. Next up, we have some scissors. Now, there's lots of different types of scissors in the medical world, but generally we can refer to them as medical scissors or surgical scissors. To provide oxygen to a patient, we use an oxygen mask. Oxygen mask. To help a patient breathe, we use a piece of equipment called a ventilator. Ventilator. And when a patient is not breathing on their own, a resuscitator can be used to help them breathe once more. Resuscitator. The type of hospital bed which moves on wheels is called a gurney. Repeat after me. Gurney. The type of bed which is used by an ambulance is sometimes referred to as a stretcher. Stretcher. Next up, we have the magnifier. Magnifier. And to help see even closer, we have a microscope. Microscope. And with some examinations, a doctor may use something like a telescope to look inside your body. Telescope. Our next device helps get medication into the lungs. Inhaler. Repeat after me. Inhaler. And the IV drip helps get medication into your bloodstream. IV, of course, stands for intravenous. Something which is commonly connected to an IV drip is a saline bag. Repeat after me. Saline bag. A blood bag is another container which is sometimes connected to an IV drip. Blood bag. The blue, green and sometimes pink outfits worn by medical personnel are known as scrubs. Scrubs. Medical personnel can also be seen wearing a surgical mask over their face at some occasions, and also a scrub cap to cover their hair. A scrub cap can also be called a skull cap. This piece of equipment is known as the examination table. Repeat after me. Examination table. And our final piece of equipment is known as a medical chair. Repeat after me. Medical chair. In this video, we will be exploring lots more English vocabulary and terms relating to healthcare and medicine. This video is perfect for anyone studying or working in any type of medicine in English. Get ready to boost your medical English knowledge with pronunciation, definitions, and lots of examples. I plan to make lots more vocabulary videos on healthcare, so if there is a specific area you wish me to cover, let me know in the comments. Don't forget to check out the extensive word list in the description. Are you ready? Sit back, relax, and let's learn some English together. Let's take a look at our first term, a runny nose. And this describes a nose that has a lot of liquid coming out of it. Let's take a look at our example sentence. We could say, Diane always has a runny nose. Diane always has a runny nose. Our next term is health hazard. And this describes something which is dangerous or a health risk. Our example sentence is, the chemicals they use are a health hazard. The chemicals they use are a health hazard. Our next term is drip. As a noun, it is short for intravenous drip, a device for administering a fluid drop by drop into a vein via an intravenous or IV route. Our example sentence is, can you change the patient's drip, please? Can you change the patient's drip, please? Our next term is a condition known as a chesty cough. And this describes a cough caused by congestion around the lungs. Our example sentence is, Diane is suffering from a chesty cough at the moment. Diane is suffering from a chesty cough at the moment. Our next term is the word chill. And this describes a feeling of coldness. Our example sentence is, Daniel caught a chill when he was out in the snow. Daniel caught a chill when he was out in the snow. The next term we will cover is cardiologist. This describes a specialist of the heart and heart activity. We could say, after his heart attack, Niall was under the care of a cardiologist. After his heart attack, Niall was under the care of a cardiologist. If you'd like to learn more English vocabulary on different types of doctors, check out my extensive video. The link for that is on screen right now. Let's move on to our next term, which is nervous breakdown. This term is sometimes used by people to describe a stressful situation in which they are temporarily unable to function normally in day-to-day life. Our example sentences: after the death of her son, Vicky had a nervous breakdown. After the death of her son, Vicky had a nervous breakdown. Our next term is the word relapse, and this word means the return of an illness. Let's take a look at our example sentence. The doctors thought David had recovered, but he suffered a relapse and is now sick again. The doctors thought David had recovered, but he suffered a relapse and is now sick again. Let's move on to our next term, which is the noun cure. This is defined as a medicine or therapy that removes disease completely or relieves pain and symptoms. Our example sentence is: scientists are trying to find a cure for cancer. Scientists are trying to find a cure for cancer. If this is your first time visiting my channel, Learning English Pro, you're very welcome. My name is Ger and I'm narrating your lesson today. Make sure to subscribe to stay updated for all my latest videos. Our next term is aches and pains. This phrase describes minor pains that continue over a period of time. We could say, the patient has had some aches and pains in her stomach for a few days. The patient has had some aches and pains in her stomach for a few days. Let's move on to our next term, which is stethoscope. This is a medical instrument for listening to the action of someone's heart or breathing. I will examine the patient with my stethoscope. I will examine the patient with my stethoscope. Our next term is ambulatory. This describes something relating to or adapted for walking. Our example sentence is: his treatment is focused on his ambulatory function. His treatment is focused on his ambulatory function. Our next term is NHS. This acronym stands for National Health Service, the famous publicly funded British healthcare system which was founded in 1948. Our example sentence is: the NHS is having difficulty recruiting staff since Brexit. The NHS is having difficulty recruiting staff since Brexit. Next up, we have a verb, to alleviate, and this is defined as an action to make suffering, a deficiency, or a problem less severe. Our example sentence is: the nurse was able to alleviate his pain when she gave him the medication. The nurse was able to alleviate his pain when she gave him the medication. And next up we have an adjective, responsive. And this describes someone or something reacting quickly and positively, and the ability to respond to a stimulus. Our sentence example is: Claire is becoming more responsive since she received her treatment. Claire is becoming more responsive since she received her treatment. Our next term is Medicaid. Medicaid in the United States is a federal and state program that helps with healthcare costs for some people with limited income and resources. We could say, she is on Medicaid, which helps pay for her asthma medication. She is on Medicaid, which helps pay for her asthma medication. Our next term is backache, and this describes a prolonged pain in the back or spine. Let's take a look at our example sentence. I have been suffering with a backache for the past 2 weeks. I have been suffering with a backache for the past 2 weeks. Our next term is a piece of medical equipment, crutch. And the definition is a long stick with a crosspiece at the top, used as a support under the armpit by a person with an injury or disability. We could say Mary is on crutches since she broke her hip bone. Mary is on crutches since she broke her hip bone. Coming up next, we have the term therapy. And this describes treatment intended to relieve or heal a disorder. And there are lots of different types of therapy. Let's take a look at our example. Her physical therapy will help her regain her stamina. Her physical therapy will help her regain her stamina. And our final term is a phrase, as fit as a fiddle. And this is a phrase meaning in good physical condition, to be very healthy and strong. Our example sentence is, my grandfather recovered from his illness and is now as fit as a fiddle. My grandfather recovered from his illness and is now as fit as a fiddle. In this English lesson, I will focus on English verbs and phrasal verbs relating to healthcare. In total, there will be 15 terms to learn with pronunciation, definition, and sentence example in 2 tenses. If you follow my channel, you will know I have already published lots of great English lessons relating to medicine and healthcare. Make sure to check out the link for some of those videos on screen right now. This video is great for anyone working in the medical field and wanting to expand and develop their English vocabulary for communication skills. Don't forget to check out the extensive word list in the description for all the English verbs covered in today's lesson. There are lots more verbs relating to healthcare, so if you'd like me to do a follow-up video, let me know in the comments. So if you're ready, sit back, relax, and let's learn some healthcare English verbs like a pro. First up, we have a regular verb, administer. Repeat after me, administer. This means to give medication or treatment to a patient. This may mean by injection, ingestion, which means to eat, application to the skin, inhalation, or other means. Our first sentence example is in the future tense. I will administer the painkiller to the patient by injection. Our next sentence is in the past tense. I administered the treatment to the patient this morning. Moving on, our next term is a phrasal verb, care for. Care for. And this means to do the things that are needed to help and protect a person or animal. It means to look after someone or something. Our next example is in the present tense. The nurses care for the patients in the hospital. Or we could say, I will care for the patient this evening. Next up, we have the regular verb to assist. Assist. And this means to help someone, typically by doing a share of the work. It can also mean being present at an event as a helper. In the past tense, we could say, 2 midwives assisted at the birth yesterday. And in the future tense, I will assist the doctor during her appointments tomorrow. Our next verb is determine. Repeat after me, determine. And this verb means to ascertain or establish exactly why something is occurring or has occurred by research or calculation. Our example is, the doctor determined that the issue is muscular. The hospital will determine the cause of her illness. Next up, we have a phrasal verb, to pass away. Pass away. And this phrasal verb simply means to die. It is a nice way to say it. Our example sentence is, the patient passed away earlier this evening. In the future tense, you would say, unfortunately, the patient will pass away soon. Coming up next, we have the regular verb to sever. Sever. And this means to divide by cutting or slicing, especially if it happens suddenly or forcibly. In the past tense, we could say, the patient severed her index finger in an accident. Let's take a look at a sentence in the future tense. During the operation, the doctor will sever the nerve. Our next verb is very commonly used in healthcare. Prescribe. Repeat after me. Prescribe. In the context of a medical practitioner, to advise and authorize the use of a medicine or treatment for someone, and this is especially done in writing. We could say, the doctor prescribed some medication for his pain. Or in the future tense, we could say, the doctor will not prescribe any more medication to you. Let's move on to our next term, which is a phrasal verb, to come down with. Come down with. And this means to become sick with a particular illness or complaint. In the present continuous, we could say, I am coming down with the case of the flu. And in the past tense, we could say, all the patients came down with the bad cold. If this is the first time you're visiting my channel, Learning English Pro, you're very welcome. My name is Jer and I'm narrating your lesson today. Make sure to subscribe to stay updated on all my latest videos. Let's get back to our verbs, and next up we have suture. Repeat after me. Suture. And this means to stitch up a wound or incision with stitches. In the future tense, we could say, I will suture your wound for you. In the past tense, we could say, the medic sutured the wounds of the soldiers during the battle. Our next term is the phrasal verb to pass out. Pass out. And this simply means to lose consciousness. And our sentence example is in the future tense. She will pass out if she sees the injection needle. And in the past tense, our sentence example is, after a few minutes, the patient passed out. The opposite of pass out is another phrasal verb, to come to. Come to. And the definition is to recover consciousness. We could say in the past tense, the patient came to after the surgery and was okay. In the future tense, we could say, she will come to in a few minutes. Let's get back to a regular verb with inject. Inject. And this means to introduce a liquid, especially a drug or vaccine, into the body with a syringe. We could say, the nurse injected the painkiller and I began to feel better. Or in the future tense, we could say, he will inject the medicine into the patient's vein. Next up, we have a phrasal verb, to fight off. Fight off. And this means to defend oneself against someone or something by fighting or struggling. So you would fight off an illness or a disease. You could say, the patient has fought off the infection very well. Our next example is, we hope she will fight off the virus in her stomach. Moving on, our next term is the regular verb to massage. Massage. And this means to rub or knead a person or part of the body with the hands. In the past tense, we could say, the patient massaged their head with the ointment. Or in the future tense, we could say, the nurse will massage the patient's shoulders. Next up, we have the regular verb to ache. Ache. And this means to suffer from a continuous dull pain. Our sentence example is, the patient said that her leg aches badly. Or we could say, my back will ache tomorrow if I lift those boxes. In today's lesson, we're going to take a look at some medicine English vocabulary. This will involve looking at the different types and forms of medicine, along with the associated symptoms. Let's take a look at our lesson plan. You'll learn lots of important vocabulary, along with perfect pronunciation and lots of context and information, so you'll really get to know the vocabulary very well. I don't know about you, but I'm ready to start this lesson, so grab a pen and paper, sit back, relax, and let's learn some English on medicine together. First up, we're going to explore symptoms in a question format and have a look at the associated medication that is used as treatment for these symptoms. Our first question is, do you have an infection? Do you have an infection? If you have a bacterial infection, you will need an antibiotic. Repeat after me. Antibiotic. Another type of infection that is common is a viral infection, an infection by a virus. And we use antiviral medication to treat a viral infection. Antiviral. Our next question is, do you have pain or fever? Do you have pain or fever? For these symptoms, you would take a painkiller. Repeat after me. Painkiller. Our next question is, do you have a cough? The word cough has an unusual pronunciation. Instead of a G sound, we have an F sound here. Do you have a cough? And the medicine for a cough has a few different names. It can be called cough syrup, cough medicine, or a cough suppressant. My next question to you is, do you have allergies? Do you have allergies? And for an allergy, we take an antihistamine. Repeat after me. Antihistamine. Let's do that one more time. Antihistamine. Our next question is, do you have asthma? Do you have asthma? The type of medicine used for asthma is a steroid. Repeat after me. Steroid. Let's move on to our next question. Do you have a blocked nose? Or we could say, do you have a stuffy nose? If you have this condition, you will need a decongestant. Repeat after me. Decongestant. And a medicine which is in the news a lot lately is related to the coronavirus. And the medicine that is being discussed is a vaccine. Repeat after me. Vaccine. Let's hope that the new vaccine is successful in the battle against coronavirus. If this is your first time with my channel, you're very welcome to Learning English Pro. My name is Jer. Make sure to subscribe and share this channel with your friends right now. I have tons of really useful vocabulary lessons on my channel. Click the link on screen now to bring you to a selection of those, and enjoy! Okay, let's get back to our lesson and let's move on to the next segment, which is different forms of medicine. We will discuss the different ways in which medicine is delivered to the human body. Medicine is often given in liquid form, and sometimes it is given in a syrup. This is a thick liquid medicine that you drink, and it can be sweet. This type of thick liquid medicine is common for symptoms in children, coughs and colds, or for adults with stomach problems. Sometimes liquid medicine needs to be given directly into the body, like into the bloodstream or into muscle. This medicine is usually given through an injection with a syringe. Liquids can also be given directly into the body by intravenous therapy. This is regularly used in hospitals to deliver medicine to patients, and the device used is simply called an IV. Medicine can also be given in tablet or pill form. Lots of different types of medication can be given in this form. And this medicine is usually round or oval shaped. Another type of tablet you may see is a soluble tablet. These tablets can be dissolved in water. The resulting mixture is then drank to cure symptoms. These types of tablets are typically used for painkillers and antacids. The next form of medication we will look at is a capsule. A capsule is a shell which contains medicine. Some people will also call these tablets or pills, and the capsule dissolves and is digested when swallowed. The next type of medicine we will look at is a lozenge. A lozenge is a small candy-like medicine that dissolves in your mouth. Lozenges are usually used to help symptoms in the mouth or throat. Our next type of medicine can be called a cream, lotion, or ointment. And this is a thick liquid medicine that is applied to the skin. Our next type of medicine is drops. This type of liquid medicine is usually used for symptoms for the eyes or the ears. The next form of medicine we will have a look at is spray. This type of liquid medicine is usually applied up the nose or onto the skin, depending on the symptoms. The final form of medicine we will have a look at is inhaler. An inhaler is used to deliver vapor medicine to the lungs. It is commonly used by people who suffer from asthma. Up next, we are going to take a look at the difference between these two terms, over-the-counter and prescription drugs. First up, let's take a look at over-the-counter and what that means. Medicine which is over-the-counter can be purchased without consent from a doctor. Depending on the country, this type of medicine can be purchased in drugstores, pharmacies, or even supermarkets. Whereas with prescription drugs, this type of medicine can be purchased only with consent from the doctor and purchased at a registered pharmacy or chemist. The consent is usually given as a paper document simply called a prescription. In this video, we will dive into the medical field of pediatrics. This is a medical specialty which focuses on the care of children. I will explain this area of medicine to you in simple English with lots of definitions and medical terminology along the way. We will be taking a look at some of the differences between a doctor treating a child and treating an adult and the reasons why this is necessary. Don't forget to check out the extensive word list in the description below and check out my many other English vocabulary videos based on medicine and medical issues. Links for those are on screen right now. Okay, if you're ready, let's get started learning all about pediatrics in English. Let's take a look at our first word in our lesson, which of course is pediatrics. And as you can see on screen, there are 3 different spellings for this. For the duration of this video, we'll be sticking with the first spelling. And let's take a look at the definition. Pediatrics is the branch of medicine that involves the medical care of infants, children, and adolescents or teenagers. In the United States of America, pediatric care is usually available to people until they reach the age of 21. However, in other parts of the world, pediatric care is usually offered until the age of 18. A doctor who specializes in this area is known as a pediatrician. Let's practice this word a few times. Pediatrician. Pediatrician. One more time. Pediatrician. And pediatricians generally work in hospitals and children's hospitals. The oldest traces of pediatric care can be found in ancient India and ancient Greece. But pediatrics as we know it didn't come around till much later. The Swedish physician Niels Rosen von Rosenstein is considered to be the founder of modern pediatrics as a medical speciality. The first generally accepted pediatric hospital is the Hôpital des Enfants Malades, which opened in Paris in June 1802 on the site of a previous orphanage. From its beginning, this famous hospital accepted patients up to the age of 15 years, and it continues to operate as a children's hospital to this day. Okay, let's move on and have a look at the differences between adult and pediatric medicine. And the reason there is a difference is because there is a substantial physiological difference between the body of a child and that of an adult. Let's take a look at a definition of this adjective physiological. This word means anything relating to the branch of biology that deals with the normal functions of living organisms and their parts. And because of children's age, congenital defects, genetic variants, and developmental issues are of greater concern to pediatricians than they often are to adult physicians. Let's take a look at some of these issues in greater detail. Congenital defects can be defined as structural or functional anomalies that occur during pregnancy. These can also be called birth defects, congenital disorders, or congenital malformations. These conditions develop prenatally and may be identified before or at birth or later in life. Genetic variation refers to diversity in gene frequencies. Gene variation can refer to differences between individuals or to differences between populations. Mutation is the ultimate source of genetic variation, but mechanisms such as sexual reproduction and genetic drift contribute to it as well. Developmental issues include delays or abnormal patterns of development in the areas of communication or language, motor skills, problem solving, or social and adaptive behavior. These concerns are usually based on comparison to children of the same age. If this is the first time you're visiting my channel, Learning English Pro, you're very welcome. My name is Jer and I'm narrating your lesson today. Make sure to subscribe to stay updated on all my latest videos. Another important aspect of pediatrics is medication, and a child's physiology directly impacts the properties of drugs that can enter the body. The absorption, distribution, metabolism and elimination of medications differ between developing children and grown adults. And let's take a look at some of the highlighted terminology in screen in greater detail. So first up we have absorption, and this is a condition in which something takes in another substance. So we would say that drug absorption is the process of a drug moving from its site of delivery, like the mouth, into the bloodstream. And many drug absorption differences between pediatric and adult populations revolve around the stomach. Young infants have different levels of acid in their stomachs, which creates a more basic environment for drugs taken orally. Our next bit of terminology is distribution. This describes the way in which something is shared out amongst a group or spread over an area. The word distribution is usually referred to in relation to the movement of goods, but drug distribution refers to the movement of a drug to and from the blood and various tissues of the body, like fat, muscle, and brain tissue, and the relative proportions of the drug in these tissues. The percentage of total body water and fluid volume decrease as children grow and develop with time. Therefore, children have a larger volume of distribution than adults, which directly affects the dosing of drugs given to them. Our next English word is metabolism. Metabolism is the chemical reactions in the body cells that change food into energy. Drug metabolism is the metabolic breakdown of drugs by living organisms, usually through specialized systems. Drug metabolism primarily occurs via enzymes in the liver and can vary according to which specific enzymes are affected in a specific stage of development. Next up, we have elimination, and this word describes the complete removal or destruction of something, or the expulsion of waste matter from the body. And in humans, drug elimination is primarily facilitated via the liver and kidneys. In infants and young children, the larger relative size of their kidneys leads to increased renal clearance of medications that are eliminated through urine. Our next topic of discussion is pediatric autonomy in healthcare. Now, what does the word autonomy mean? Let's take a look at the definition. Autonomy is the capacity to make an informed, uncoerced decision, or it can be called freedom from external control or influence, or independence. Simply put, it's the freedom to make decisions for yourself and your own body. So this word is important when we talk about pediatric healthcare. A major difference between the practice of pediatric and adult medicine is that children in most jurisdictions, and with certain exceptions, cannot make decisions for themselves. The issues of guardianship, privacy, legal responsibility, and informed consent must always be considered in every pediatric procedure. Today we will cover vocabulary related to the anatomy, and more specifically, body systems. Our first words are the muscular system. Repeat after me. The muscular system. In the muscular system, we have muscle. Repeat after me. Muscle. Next up, we have the nervous system. Repeat after me. The nervous system. And in the nervous system, you will find a nerve. Nerve. Our next system is the circulatory system. The circulatory system. In the circulatory system, you will find an artery, which takes oxygen-rich blood away from the heart. And you will also find a vein. Veins deliver blood which is lower in oxygen back towards the heart. And of course, our next word is blood. Repeat after me. Blood. And within blood, we find red blood cells. red blood cells, and these of course carry the oxygen around the body. Also in blood we have white blood cells. White blood cells, and these help fight infection. Next up we have a special image from an electron microscope of a platelet. Repeat after me. Platelet. And these help heal us when we get cut or have scars. And doing all the work in the circulatory system is the heart. Heart. Our next body system is the respiratory system. Respiratory system. And here we have the lungs. Lungs. Also in the respiratory system we have the trachea. Trachea. Our next body system is the digestive system. The digestive system. And the first part of the digestive system we'll look at is the stomach. Repeat after me. Stomach. This is the large intestine. Large intestine. And here we have the small intestine. Small intestine. And the next part of the digestive system we'll look at is esophagus. Repeat after me. Esophagus. And the last part of the digestive system we'll cover today is the mouth. Mouth. In this week's video, I am covering the respiratory system and lots of additional English vocabulary like different parts of the lungs, medical terminology, verbs, nouns, and lots of medical context for you. I have already published many videos on medical topics, so click the link on screen now to bring you to a selection of those videos. Don't forget to check out the word list in the description below. Okay, if you're ready, let's get started. And the first part of the respiratory system we will take a look at is of course the lungs. Repeat after me. Lungs. And this is the plural form of this noun as we generally talk about them as a pair. And below the lungs we have the diaphragm, and the G here is silent. Diaphragm. Our next body part is the nose, and this is where the air enters our bodies through the nostrils. And behind the nose we have the nasal cavity. And here you can also find the paranasal sinuses. And air can also enter our bodies through the oral cavity. Next up we have the pharynx, which is located at the back of the throat, and this is where air and food enter into the body. Next up we have the larynx, commonly known as the voice box, and when air passes through this, it gives us our voice. And from here, air then passes through the trachea, also known as the windpipe. Let's take a closer look at the internal structure of the lungs. At the carina of trachea, the windpipe branches out into these two separate lungs, the right lung and the left lung. Next up we have the right and left bronchus. And from these, air passes into the bronchi. And from the bronchi, air then passes through the alveoli. The alveoli are the endpoint of the respiratory system. And this is where the exchange of oxygen and carbon dioxide takes place in the bloodstream. And this covers all the main different parts of the respiratory system. Now let's move on and break down lots of different associated vocabulary you can use when talking about the respiratory system. First up, we have the verb to breathe. This word means to take air into the lungs and then expel it, especially as a regular physiological process. A noun which is often confused with the verb breathe is breath. And this noun describes the actual air taken into or expelled from the lungs. You might have heard someone's breath being described as bad breath, and this means that someone has an unpleasant smell to their breath. Next up, we have the noun oxygen. And this of course describes the colourless, odourless gas and the life-supporting component of the air. In hospitals, oxygen is kept in oxygen tanks, and we often talk about oxygen supply, and this means the level of oxygen going into the body. Our next word is the term asthma. Repeat after me. Asthma. Asthma is a condition in which your airways narrow and swell and may produce extra mucus. This can make breathing difficult and trigger coughing, a whistling sound when you breathe, and shortness of breath. Don't worry if you don't understand all these words, I'll be covering them in just a moment. Asthma is usually treated with steroids delivered into the lungs by an inhaler. Let's review some of these words we just saw in that definition. Airways is a noun, and it describes the passage by which air reaches a person's lungs. So it's a synonym of the word trachea or windpipe. Airways. Our next word is the noun mucus. Mucus is a normal, slippery and stringy fluid substance produced by many lining tissues in the body. We also have the word phlegm, which is a type of mucus produced in the lungs and the lower respiratory tract. Let's take a closer look at the pronunciation of phlegm, and as you can see on screen, the PH is pronounced as an F. And we have a silent G, so this word is quite deceptive. Phlegm. Next up, we have the term shortness of breath. And this means an uncomfortable condition that makes it difficult to fully get air into your lungs. You could say the patient is suffering with a shortness of breath. Next up, we have the noun pulmonologist. Now, what is a pulmonologist? This word describes a physician who specializes in the respiratory system. So if you have a problem with your respiratory system, you go to the doctor called a pulmonologist. If you'd like more vocabulary on different types of doctors, check out my video. The link is on screen for that right now. Our next English word is cough. A cough is a voluntary or involuntary act that clears the throat and breathing passage of foreign particles, microbes, irritants, fluids, and mucus. It is a rapid expulsion of air from the lungs. Coughing can be done deliberately or as part of a reflex. The word cough is both a noun and a verb. A noun sentence example would be, she has a cough. She has a cough. Let's take a look at a verb sentence example. The patient coughed a lot this morning. The patient coughed a lot this morning. Our next word is sneeze. A sneeze is a semi-autonomous, convulsive expulsion of air from the lungs through the nose and mouth, usually caused by foreign particles irritating the nasal membrane. And like the word cough, sneeze is both a noun and a verb. So again, let's have a look at two separate sentence examples. Our noun example is, a sneeze can help clear your nose. A sneeze can help clear your nose. Our verb example is, she sneezed a lot this morning. She sneezed a lot this morning. Let's move on to our next term, which is chest infection. A chest infection is an infection of the lungs or large airways. Some chest infections are mild and clear up on their own, but others can be severe and life-threatening. The main types of chest infection are bronchitis and pneumonia. Most bronchitis cases are caused by viruses, whereas most pneumonia cases are due to bacteria. These infections are usually spread when an infected person coughs or sneezes. So just to reiterate, bronchitis is caused by viruses and pneumonia is caused by bacteria. If this is the first time you're visiting Learning English Pro, you're very welcome. My name is Jer and I'm narrating your lesson today. Make sure to subscribe to stay updated on all my latest videos. Let's move on to our next word, which is the verb to inhale, and this means to breathe in. Then we have the opposite of this word, the verb to exhale, which means to breathe out. An example sentence for inhale is, we inhale oxygen all the time. And for exhale, the patient exhaled deeply after the procedure. Our next two words are very similar to inhale and exhale. The noun inhalation means the action of inhaling or breathing in. And of course, we have the noun exhalation, which describes the action of exhaling or breathing out. Let's take a look at some examples. You need to take a few deep inhalations. The patient's exhalations are very raspy. Today's crucial lesson is about first aid English. We'll cover essential phrases you need to know in emergency situations. And all the phrases covered in today's lesson are waiting for you in the video description if you want to follow along or revise. This lesson will be a lifesaver, so let's get started. In an emergency, asking the right questions is vital. Here are some key phrases. Are you okay? Where does it hurt? Can you breathe normally? Practicing these questions can help you assess the situation quickly and efficiently. Next, let's learn how to offer help. Being able to communicate effectively in these moments is crucial. I know first aid. Can I help? Stay calm. Help is on the way. Keep the wound clean and covered. These phrases are essential for providing immediate assistance and reassurance. Sometimes you may need to seek help from others. Here's phrases for what you could say. Call an ambulance immediately. We need a doctor. Is there a first aider nearby? Knowing how to call for help effectively can make all the difference in an emergency. That's it for our first aid English lesson. Remember, these phrases could be crucial in an emergency, so practice them well. Today we're diving into essential English phrases you might need in a hospital setting. Whether you're traveling, working, or just expanding your vocabulary, this lesson is for you. All the phrases covered in today's lesson are waiting for you in the video description if you want to revise or follow along. Also in the video description is the link to my playlist on medical English, full of lots and lots of useful lessons. So let's get started. First, let's cover greetings and basic questions. In a hospital, you might need to ask for help or directions. Someone might ask you, "How can I help you?" We could respond, "Hello, I am looking for the emergency department." Or we could say, "I need to see a doctor." Or maybe you're visiting someone. "I am visiting my aunt. Could you tell me her room number?" Practice these phrases to feel confident in asking for initial assistance. Let's move on to phrases related to describing symptoms. A doctor or a nurse might ask you, "What are your symptoms?" They could also ask you, "How are you feeling?" I have a headache. I feel dizzy. My stomach hurts. Being clear about your symptoms will help medical professionals understand and assist you better. It's also important to understand common responses from medical staff. You may be asked some of the following things. Please fill out this form. Do you have any allergies? Follow me, please. Knowing these phrases helps you follow instructions and respond appropriately. In emergencies, knowing a few key phrases can be crucial. Call a doctor. It's an emergency. I need help immediately. These phrases are vital for urgent situations, so remember them well. You're very welcome to my exclusive masterclass in medical English. I've merged my 15 most popular and informative English lessons on medical topics into one comprehensive masterclass. From doctor-patient dialogue to the specific jargon of surgeries and pharmaceuticals, this video is a goldmine for anyone eager to master the language of healthcare. I've designed this masterclass to sharpen your skills and deepen your understanding. Join me on this enlightening journey through the world of medical English. So if you're ready, let's get started on our English lesson on diseases and disorders. The first word on our list is asthma. Asthma is a chronic respiratory condition that causes difficulty in breathing due to narrowed airways and increased mucus production. Next up, we have hypertension. Hypertension, also known as high blood pressure, is a condition where the force of blood against artery walls is consistently too high, increasing the risk of heart disease and stroke. Moving on, let's talk about diabetes. Diabetes is a metabolic disorder characterized by high blood sugar levels, often resulting from the body's inability to produce or use insulin effectively. Arthritis is another term on our list. It's used to describe various inflammatory joint diseases that cause pain, stiffness, and swelling. Now let's learn about influenza, or the flu. Influenza is a contagious respiratory illness caused by influenza viruses, presenting symptoms like fever, cough, and body aches. Next word is depression. Depression is a mental health disorder characterized by persistent sadness, loss of interest, and lack of energy. Alzheimer's disease is a progressive neurological disorder that affects memory and cognitive functions, primarily occurring in older individuals. Cancer refers to a group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. Another term is obsessive-compulsive disorder, or OCD. OCD is a mental health condition where individuals experience recurring unwanted thoughts and engage in repetitive behaviors to alleviate anxiety. Now let's understand epilepsy. Epilepsy is a neurological disorder that causes recurrent seizures due to abnormal brain activity. Pneumonia is a serious respiratory infection that inflames the air sacs in one or both lungs, leading to coughing, fever, and difficulty breathing. Next, we have anemia. Anemia is a condition characterized by a deficiency of red blood cells, or hemoglobin, resulting in fatigue and weakness. A migraine is a severe headache accompanied by sensitivity to light and sound. Rheumatoid arthritis is an autoimmune disease that primarily affects the joints, causing inflammation and pain. Hepatitis refers to the inflammation of the liver, which can be caused by viral infections, alcohol, or certain medications. Atherosclerosis is a condition where plaque builds up inside the arteries, restricting blood flow and increasing the risk of heart attacks and strokes. Schizophrenia is a mental disorder characterized by delusions, hallucinations, and disordered thinking and behavior. Osteoporosis is a condition where bones become weak and brittle, increasing the risk of fractures. Fibromyalgia is a chronic pain condition characterized by widespread musculoskeletal pain, fatigue, and tenderness in specific areas. Lastly, let's explore gastritis. Gastritis is the inflammation of the stomach lining, often causing stomach pain, nausea, and indigestion. I hope you enjoyed that lesson on diseases and disorders, some really important terminology there. Next up, we're going to move on to a lesson on English phrases you might use at a doctor's appointment. I need to make an appointment with the doctor, please. You can use this phrase to request a doctor's appointment politely and efficiently. Try it after me. I need to make an appointment with the doctor, please. Let's move on to our next phrase. I've been feeling unwell lately. This phrase is how you can express your general discomfort to the doctor clearly. I've been feeling unwell lately. I have a sore throat and a cough. With this phrase, you are describing your symptoms accurately to assist in diagnosis. I have a sore throat and a cough. I have a fever. This is what we would say in English if we have a higher than usual body temperature. Repeat after me. I have a fever. I twisted my ankle and it hurts. This is how we might explain to the doctor the cause of your pain and its location. I twisted my ankle and it hurts. I've had a headache for a few days. This is how you convey the duration of your headache for better evaluation. I've had a headache for a few days. I think I might have the flu. With this phrase, you can express your suspicions about your illness, prompting further investigation. I think I might have the flu. Let's move on to our next phrase. I need a prescription for my medication. This is how you request a prescription if it's necessary for your treatment. I need a prescription for my medication. Do I need to take any tests? This is how you might inquire about diagnostic tests that may be required. Do I need to take any tests? Is there a pharmacy nearby? With this phrase, we are asking about the availability of a nearby pharmacy for your prescription. Is there a pharmacy nearby? How much will this medication cost? This is how you inquire about the cost of prescribed medications or treatments. How much will this medication cost? Can you recommend any over-the-counter remedies? When we ask the doctor about over-the-counter remedies, we are asking for recommendations on non-prescription treatments for minor issues. Repeat after me. Can you recommend any over-the-counter remedies? What are the side effects of this medicine? We can use this phrase to learn how to ask about potential side effects of prescribed medications. What are the side effects of this medicine? When should I come back for a follow-up appointment? This phrase is for finding out how to schedule a follow-up appointment to monitor your progress. When should I come back for a follow-up appointment? Thank you for your help, doctor. And with our final phrase, we can express our gratitude to the doctor for their assistance. Thank you for your help, doctor. Hello, you're very welcome to this English vocabulary lesson on doctors. Let's dive right in and have a look at the lesson plan for today's video. So first up, what you need to know is that you'll be learning all about the different types of doctors and their names in English. And of course, this is Learning English Pro, so you'll be learning lots of essential vocabulary relating to each type of doctor. And with this key vocabulary comes essential context. Learn lots of history and important information about the different types of doctors you will learn in this lesson. So it promises to be a really exciting and interesting lesson for you today. So if you're ready, sit back, relax, and let's learn some English on doctors together. Our first type of doctor is a general practitioner. Now this is the British English. General practitioner. It can also be shortened to just GP. GP. Now, this might be more commonly known as a family doctor or your local doctor. In American English, it is commonly referred to as a medical doctor. And this role can also be referred to in American English as a physician. So let's move on and have a look at some additional information and context for a physician or a GP. The area of medicine they work in is known as general medicine. And did you know the earliest documentation for a formal hospital with physicians that treated patients comes from the 5th century BC in Sri Lanka? Hippocrates, who lived from 460 to 377 BC, is commonly called the father of medicine. He is thought to be one of the first physicians to treat disease as being a result of natural rather than supernatural causes. And because of him, we have the Hippocratic Oath, which is an oath of ethics historically taken by physicians. In its original form, it requires a new physician to swear to uphold specific ethical standards. Okay, it's time to move on to our next type of doctor, which is a pediatrician. Repeat after me. Pediatrician. So what does a pediatrician do? A pediatrician is a medical doctor who manages overall health for children from birth until age 18. And the area of medicine is called pediatric medicine. And the very first pediatric hospital was opened in Paris, France in 1802. Let's move on to our next type of doctor, a neurologist. Repeat after me. Neurologist. Neurologists are specialists who treat diseases of the brain and spinal cord, peripheral nerves and muscles. And the field that a neurologist works in is called neurology. Neurologist treats serious conditions like stroke, Alzheimer's disease, and multiple sclerosis. Our next doctor type is a dermatologist. Repeat after me. Dermatologist. And of course, a dermatologist works in the area of dermatology. A dermatologist is a doctor who specializes in conditions involving the skin, hair, and nails. A dermatologist can identify and treat more than 3,000 conditions. These conditions include eczema, psoriasis, and skin cancer, among many others. Next up, we have anesthesiologist. This one's quite tricky. Anesthesiologist. Let's try it one more time. Anesthesiologist. An anesthesiologist works in the area of anesthetics. This provides treatments such as anesthesia, intensive care medicine, critical emergency medicine, and pain medicine. Anesthesia is a state of controlled temporary loss of sensation or awareness that is induced for medical purposes. Our next medical doctor is a dentist. Repeat after me. Dentist. A dentist works in the area of dentistry. A dentist, also known as a dental surgeon, is a surgeon who specializes in dentistry, the diagnosis, prevention, and treatment of diseases and conditions of the mouth. Have you ever thought about who the first dentist was? Heze-Ra is the earliest dentist whose name is known to us. Around 2600 BC in ancient Egypt, he was known as the chief of dentists. Our next doctor type is an oncologist. Repeat after me. Oncologist. An oncologist works in the area of oncology, but this is more commonly known as cancer treatment. These are doctors who treat cancer and provide medical care for a person diagnosed with cancer. In the area of oncology, there are three major areas: medical, surgical, and radiation. An oncologist treats cancer using chemotherapy or other medications, such as immunotherapy. Let's move on to our next doctor type, a surgeon. Repeat after me. Surgeon. A surgeon works in the area of surgery. And surgery is used to investigate or treat conditions such as disease or injury, to help improve bodily function, appearance, or to repair unwanted ruptured areas. If we look back in history, surgery in different forms has been performed by humans for thousands of years. The earliest evidence comes from over 8,500 years ago. Let's move on to our next doctor, which is a cardiologist. Repeat after me. Cardiologist. A cardiologist works in the area of cardiology, and they are doctors who diagnose, assess, and treat patients with diseases and defects of the heart and blood vessels. Let's take a moment to talk about the human heart. The average heart is the size of a fist in an adult. Your heart will beat about 115,000 times each day. It also pumps about 2,000 gallons of blood every day as well. Our next type of doctor is a radiologist. Repeat after me. Radiologist. A radiologist works in the area of radiology. And they are medical doctors that specialise in diagnosing and treating injuries and diseases using medical imaging procedures. Let's take a look at the types of imaging procedures. There are X-rays, computed tomography, which is also called a CT scan, magnetic resonance imaging, also called an MRI, positron emission tomography, PET, or an ultrasound. Let's move on to our final doctor of this lesson, a psychiatrist. Repeat after me, psychiatrist. These doctors work in the area called psychiatry. A psychiatrist can diagnose and prescribe medication to treat a variety of complex mental illnesses, such as depression and bipolar disorder. In the area of psychiatry, a founding father of this medical field is Sigmund Freud. He was an Austrian neurologist and the founder of psychoanalysis, a clinical method for treating psychopathology through dialogue between a patient and a psychoanalyst. Today we're delving into the dynamic field of emergency medicine. Whether you're a healthcare professional, a student, or simply interested in expanding your English vocabulary, you're in for an informative ride. So if you're ready, let's begin our English lesson, and we're going to start with the topic of today's lesson, emergency medicine. This is a medical speciality focused on the prompt assessment, diagnosis, and treatment of acute illnesses and injuries. Emergency physicians work in emergency departments to provide immediate care and stabilize patients in critical conditions. Our next term is triage. Repeat after me. Triage. Triage is the process of quickly assessing and prioritizing patients based on the severity of their condition. It ensures that those with the most urgent needs receive immediate attention. Triage. Trauma refers to physical injuries resulting from accidents, falls, or violence. Emergency medicine often deals with trauma cases that require rapid intervention. Repeat after me. Trauma. Resuscitation involves efforts to revive or restore normal bodily functions in a patient experiencing cardiac arrest, respiratory failure, or other life-threatening emergencies. Resuscitation. Related to the term resuscitation, we have defibrillation. This is the delivery of an electric shock to the heart to restore its normal rhythm. Automated external defibrillators, or AEDs, are commonly used in emergency situations. Defibrillation. We also have cardiopulmonary resuscitation, often called CPR. This is a life-saving technique that combines chest compressions and rescue breaths to maintain blood circulation and oxygenation in a person whose heart has stopped. Intubation involves inserting a tube into the airway to assist or secure the passage of air into the lungs. It is often performed in cases of respiratory distress. Repeat after me. Intubation. Our next term is epinephrine. Repeat after me. Epinephrine. This can also be known as adrenaline. It is a hormone and medication used in emergency situations to treat severe allergic reactions, also known as anaphylaxis, and cardiac arrest. Let's try it one more time. Epinephrine. Intravenous therapy, or IV therapy for short, involves giving fluids, medications, or blood products directly into a patient's veins, ensuring rapid absorption in emergency situations. So we have intravenous therapy, or the abbreviation is IV therapy. In the context of emergency medicine, shock is a life-threatening condition where insufficient blood flow to vital organs leads to cellular and organ dysfunction. Prompt intervention is crucial to prevent further complications. Shock. Our next term is hemorrhage. A hemorrhage is excessive bleeding, and controlling it is a critical aspect of emergency medical care. Techniques like direct pressure and tourniquets may be used. Repeat after me. Hemorrhage. A fracture is a break or crack in a bone. Emergency medicine addresses fractures with assessments, immobilization, and referral to specialized care. Fracture. Our next term is naloxone. This is a medication used to rapidly reverse opioid overdose by binding to opioid receptors, restoring normal respiration. Naloxone. Let's move on to seizure. A seizure is a sudden, uncontrolled electrical disturbance in the brain. A seizure can sometimes be referred to as a fit. This condition is supported with emergency medicine with medications and supportive care. Seizure. Decontamination involves the removal or neutralization of harmful substances from a person. This is often necessary in cases of chemical exposure or contamination. Decontamination. In today's lesson, we will explore essential medical examination terminology. Understanding these words is crucial for effective communication in healthcare settings. Our first term is physical examination. This is a thorough assessment of a patient's body to evaluate their overall health. Physical examinations involve checking vital signs, palpating for abnormalities, and visually inspecting the body. Blood pressure measurement is the measurement of the force of blood against the walls of the arteries. Blood pressure is typically recorded as systolic or diastolic pressure in millimeters of mercury. An X-ray is a diagnostic imaging technique that uses electromagnetic radiation to create images of the internal structures of the body. X-rays are commonly used to visualize bones and detect abnormalities in the lungs and other organs. Ultrasound is a non-invasive imaging technique that uses high-frequency sound waves to create real-time images of internal organs. Ultrasounds are often used during pregnancy to monitor fetal development and for abdominal and pelvic examinations. MRI, or magnetic resonance imaging, is a medical imaging technique that uses strong magnetic fields and radio waves to generate detailed images of the body's internal structures. MRIs provide high-resolution images of soft tissues like the brain, spinal cord, and joints. An ECG, or electrocardiogram, is a test that records the electrical activity of the heart over time. These are crucial tests in diagnosing heart conditions by displaying the heart's rhythm and identifying irregularities. The next few terms involve blood and internal examinations, so if you're a little bit squeamish, skip ahead to the time indicated on screen. A blood test is a laboratory analysis of a blood sample to assess for various health markers. Blood tests can reveal information about blood cell counts, cholesterol levels, and the presence of infections or diseases. Endoscopy is a procedure that uses a flexible tube with a camera to examine the interior of organs or body cavities. Endoscopies are commonly performed to inspect the gastrointestinal tract, throat, or bladder. A biopsy is a medical procedure involving the removal of a small sample of tissues or cells from a patient's body for examination under a microscope. Biopsies are performed to diagnose the presence of diseases or conditions such as cancer or infections. Today, we're diving into the fascinating world of healthcare professions. Each of these medical professions play a unique and vital role in the healthcare ecosystem. So, if you're ready, let's embark on this journey together. And first up, we have the speech-language pathologist. These are experts in communication and swallowing disorders. They assess, diagnose, and provide therapy to restore effective communication. Speech-language pathologists work with children and adults, helping those with speech, language, voice, and fluency disorders regain their ability to communicate effectively. Next up, we have occupational therapists. They are dedicated to helping individuals regain and improve their abilities to perform daily life activities. Occupational therapists work with patients of all ages who, due to physical, mental, or developmental conditions, need assistance in learning new ways to perform day-to-day activities. Physical therapists specialize in diagnosing and treating injuries and conditions affecting a person's physical movement and function. They use various therapies, exercises, and techniques to aid recovery. Physical therapists design personalized treatment plans for patients, targeting pain relief, improved mobility, and the restoration of function. Our next profession is a radiologic technologist. This medical professional is responsible for performing various medical imaging procedures such as X-rays and MRIs, ensuring the accurate capture of diagnostic images. They play an important role in diagnostic imaging, working closely with patients and physicians to capture high-quality images essential for medical diagnosis and treatment planning. Respiratory therapists specialize in the care of individuals with breathing and cardiopulmonary disorders. They provide critical treatments, therapies, and diagnostic testing to ensure optimal respiratory health. Respiratory therapists work with patients of all ages, from premature infants with underdeveloped lungs to elderly individuals with chronic respiratory conditions. Medical laboratory technicians are the unseen heroes of healthcare, conducting essential tests on patient samples to assist in disease diagnosis and monitoring. Pharmacists are medication experts, ensuring the safe and effective use of prescription and over-the-counter drugs. They provide medication counseling, oversee drug dispensing, and collaborate with healthcare providers to optimize patient medication regimes. Physician assistants practice medicine under physician supervision. They diagnose, treat, and manage various medical conditions, offering a wide range of healthcare services. Dental hygienists specialize in oral health, providing preventative dental care, cleaning teeth, and educating patients on proper oral hygiene practices. They work closely with dentists to ensure optimal oral health and often perform teeth cleanings, oral examinations, and education on maintaining healthy teeth and gums. An optometrist is an eye care specialist who will examine, diagnose, and treat vision problems and eye diseases. They prescribe corrective lenses such as eyeglasses and contact lenses and provide comprehensive vision care services. Optometrists also detect and manage various eye conditions, contributing to overall eye health. Chiropractors specialize in musculoskeletal health, emphasizing manual adjustments to the spine and other parts of the body to relieve pain and improve function. Chiropractors use non-invasive techniques to treat conditions such as back pain, neck pain, and other musculoskeletal issues, often without the need for surgery or medication. Our next professional role is a nutritionist, which can also be known as a dietitian. These are experts in food and nutrition, helping individuals make healthy food choices, manage dietary restrictions, and address nutritional needs. They work in various settings, including healthcare facilities, schools, and private practice, offering personalized nutrition guidance and education. Clinical psychologists provide therapy and counseling for individuals dealing with mental health issues and emotional well-being, helping patients overcome challenges and improve their mental health. Clinical psychologists use evidence-based approaches to diagnose and treat various psychological conditions, supporting patients on their journey to mental well-being. Medical social workers offer vital support to patients and families, helping them cope with medical conditions and navigate the healthcare system. They provide emotional support, connect patients with necessary resources, and ensure that patients' psychosocial needs are addressed throughout their medical journey. A paramedic, or an EMT stands for Emergency Medical Technicians, are the first responders, delivering emergency medical care and transportation to individuals facing injuries or acute medical conditions. They provide immediate medical intervention, including administering medications, performing life-saving procedures, and transporting patients to medical facilities for further care. An audiologist is a medical professional who specializes in hearing and balance disorders, providing diagnostic evaluations and treatments for patients of all ages. They help individuals with hearing impairments by offering solutions such as hearing aids and assistive listening devices. Prosthetists design, fit, and fabricate prosthetic limbs and braces to help individuals regain mobility and functionality. They work closely with patients to customize and provide these devices, offering improved quality of life. Medical illustrators combine their artistic skills with medical knowledge to create detailed illustrations and visual aids used in medical textbooks, patient education materials, and presentations. They play a crucial role in simplifying complex medical concepts for various audiences. Medical librarians manage and organize medical information and research resources in healthcare settings. They assist healthcare professionals in finding the latest medical literature and research, supporting evidence-based practice. Medical dosimetrists work in radiation oncology, calculating radiation doses and treatment plans for patients undergoing radiation therapy. They collaborate with radiation oncologists and medical physicists to ensure the safe and effective delivery of this treatment. In today's lesson, we're going to take a look at some medicine English vocabulary. This will involve looking at the different types and forms of medicine, along with the associated symptoms. Let's take a look at our lesson plan. You'll learn lots of important vocabulary, along with perfect pronunciation, and lots of context and information, so you'll really get to know the vocabulary very well. I don't know about you, but I'm ready to start this lesson, so grab a pen and paper, sit back, relax, and let's learn some English on medicine together. First up, we're going to explore symptoms in a question format and have a look at the associated medication that is used as treatment for these symptoms. Our first question is, do you have an infection? Do you have an infection? If you have a bacterial infection, you will need an antibiotic. Repeat after me. antibiotic. Another type of infection that is common is a viral infection, an infection by a virus. And we use antiviral medication to treat a viral infection. Antiviral. Our next question is, do you have pain or fever? Do you have pain or fever? For these symptoms, you would take a painkiller. Repeat after me. Painkiller. Our next question is, do you have a cough? The word cough has an unusual pronunciation. Instead of a G sound, we have an F sound here. Do you have a cough? And the medicine for a cough has a few different names. It can be called cough syrup, cough medicine, or a cough suppressant. My next question to you is, do you have allergies? Do you have allergies? And for an allergy, we take an antihistamine. Repeat after me. Antihistamine. Let's do that one more time. Antihistamine. Our next question is, do you have asthma? Do you have asthma? The type of medicine used for asthma is a steroid. Repeat after me. Steroid. Let's move on to our next question. Do you have a blocked nose? Or we could say, do you have a stuffy nose? If you have this condition, you will need a decongestant. Repeat after me. Decongestant. And a medicine which is in the news a lot lately is related to the coronavirus. And the medicine that is being discussed is a vaccine. Repeat after me. Vaccine. Let's hope that the new vaccine is successful in the battle against coronavirus. And let's move on to the next segment, which is different forms of medicine. We will discuss the different ways in which medicine is delivered to the human body. Medicine is often given in liquid form, and sometimes it is given in a syrup. This is a thick liquid medicine that you drink, and it can be sweet. This type of thick liquid medicine is common for symptoms in children, coughs and colds, or for adults with stomach problems. Sometimes liquid medicine needs to be given directly into the body, like into the bloodstream or into muscle. This medicine is usually given through an injection with a syringe. Liquids can also be given directly into the body by intravenous therapy. This is regularly used in hospitals to deliver medicine to patients, and the device used is simply called an IV. Medicine can also be given in tablet or pill form. Lots of different types of medication can be given in this form. And this medicine is usually round or oval shaped. Another type of tablet you may see is a soluble tablet. These tablets can be dissolved in water. The resulting mixture is then drank to cure symptoms. These types of tablets are typically used for painkillers and antacids. The next form of medication we will look at is a capsule. A capsule is a shell which contains medicine. Some people will also call these tablets or pills, and the capsule dissolves and is digested when swallowed. The next type of medicine we will look at is a lozenge. A lozenge is a small candy-like medicine that dissolves in your mouth. Lozenges are usually used to help symptoms in the mouth or throat. Our next type of medicine can be called a cream, lotion, or ointment. And this is a thick liquid medicine that is applied to the skin. Our next type of medicine is drops. This type of liquid medicine is usually used for symptoms for the eyes or the ears. The next form of medicine we will have a look at is spray. This type of liquid medicine is usually applied up the nose or onto the skin, depending on the symptoms. The final form of medicine we will have a look at is inhaler. An inhaler is used to deliver vapor medicine to the lungs. It is commonly used by people who suffer from asthma. Up next, we are going to take a look at the difference between these two terms, over-the-counter and prescription drugs. First up, let's take a look at over-the-counter and what that means. Medicine which is over-the-counter can be purchased without consent from a doctor. Depending on the country, this type of medicine can be purchased in drugstores, pharmacies, or even supermarkets. Whereas with prescription drugs, this type of medicine can be purchased only with consent from the doctor and purchased at a registered pharmacy or chemist. The consent is usually given as a paper document simply called a prescription. And that brings us to the end of our lesson. If you're worried about any of the symptoms that we discussed in today's lesson, make sure to talk to your local doctor. Today we're delving into the world of over-the-counter medications, those readily available without a prescription. By the end of this video, you'll be bursting with lots of new English vocabulary. We are going to explore 12 popular medications you can buy over the counter. We're going to learn their pronunciation along with related symptoms, plus lots and lots of synonyms. Also, for every medication type, I will give you 2 phrases and questions for the pharmacy to really help contextualize the terms and boost your conversational skills. Let's dive into the world of self-care and medicine. And first, let's break down the term over-the-counter. This term refers to medications or products that are available for purchase without requiring a prescription from a healthcare professional. These products are typically deemed safe for use without direct supervision by a doctor and are accessible to consumers directly from pharmacies, drugstores, or other retail outlets. Let's move on to our medication types. An analgesic can also be known as a pain reliever and can help with lots of different types of pain, like a headache, toothache, dental pain, or even a backache. Another term for analgesic could be painkiller. Common examples of an analgesic include acetaminophen and ibuprofen. Let's take a look at our example sentences. Hi, I have a headache. Can you recommend an analgesic and advise on dosage? The term dosage or dose relates to the quantity of medicine you need to take for your condition, and this information will also tell you how many times a day you need to take it. Let's move on to our next example sentence. I have some dental pain. Could I get some aspirin, please? Aspirin is a common drug for relieving minor aches, pains, and fevers. People also use it as an anti-inflammatory or a blood thinner. Our next medication type is an antihistamine. Repeat after me. Antihistamine. This type of drug is used to treat allergies, and it can also be referred to as allergy medication. An allergy is where your body reacts to something that's normally harmless, like pollen, dust, nuts, or animal fur. The symptoms can be mild, but for some people, they can be very serious. Examples of antihistamine drugs include loratadine and diphenhydramine. Let's move on to our example sentences. I have seasonal allergies. Which antihistamine do you suggest, and how often should I take it? I am suffering from some hay fever. Can you recommend an antihistamine? Hay fever is an allergic reaction to pollen, usually when it comes into contact with your mouth, nose, eyes, and throat. Pollen is a fine powder that comes from plants. Our next over-the-counter medication is a decongestant. Decongestants relieve nasal congestion. Nasal congestion is more commonly referred to as a stuffy nose or a blocked nose, and the medical term for this condition is rhinitis. Examples of this medication include pseudoephedrine and phenylephrine. I'm congested. Could you recommend a decongestant, and how often should I use it? I have a really stuffy nose. Which decongestant is the best in your opinion? An expectorant helps loosen mucus. A more common term for an expectorant is cough medicine or cough syrup. This medicine helps with a condition known as a chest infection. And mucus is the slippery green substance that can cause congestion in our lungs when we're sick. It can also be referred to as phlegm. Guaifenesin is a common example of an expectorant medication. Let's check out our example sentences. I have a chest infection with a lot of mucus. Which expectorant would you suggest? Hello, I need to get some cough medicine for my son. Which one is best for children? Another medication helped to use a cough is an antitussive. An antitussive suppresses coughing, so we can also call this medication a cough suppressant. This type of medication is usually given in the form of a syrup, just like the expectorant. A widely used cough suppressant is dextromethorphan. My cough is keeping me up at night. Can you recommend an antitussive, and what's the recommended dosage? I've had a cough for a few days. Do you think I need an expectorant or a suppressant? If you're really interested in learning more medical English, you should definitely check out my channel Learning English Pro, where I have a vast assortment of medical-related English vocabulary lessons. Medical-related videos are my most popular topic on YouTube, so I'm constantly adding to this playlist every week. All the links for these videos and playlists are in the video description waiting for you. Antacids neutralize stomach acid, relieving symptoms of indigestion and heartburn. Antacids are available in different forms of medication, such as liquids or chewable tablets. Common examples of antacid include Tums and Malox. I'm experiencing heartburn. Which antacid is effective, and how many tablets can I take at once? I have indigestion. Would you recommend a liquid or chewable tablet antacid? Let's move on to laxatives. Laxatives promote bowel movements and are helpful if one is suffering from constipation. There are lots of different types of laxatives. Common types include stimulants and bulk-forming laxatives. I'm constipated and need a laxative. How long does it usually take to work? Hi, my elderly mother is having trouble with her bowel movements. Is there a laxative you could suggest for an older person? On the opposite side of the scale, we have an antidiarrheal. Antidiarrheals control diarrhea. With the word diarrhea, we have different spellings in American and British English. Diarrhea is when your stools are loose and watery. You may also need to go to the bathroom more often. And for this condition, loperamide is a commonly used antidiarrheal. I have an upset stomach and diarrhea. Can you recommend an antidiarrheal, and how often should I take it? I have had diarrhea for a few days. Can you suggest an antidiarrheal that is fast working and effective? Let's move on to topical analgesic. Topical analgesics relieve pain on the skin or muscles. This type of medication can be referred to as pain-relieving cream or ointment. Examples of topical analgesics include creams or patches containing menthol or lidocaine. Let's check out our example sentences. I have muscle soreness. Would a topical analgesic like a menthol cream help, and how often should I apply it? I have some muscle pain in my thigh. Could I have a skin patch with an analgesic? Our next over-the-counter medication is an antifungal. Antifungals treat fungal infections, such as athlete's foots or rashes of a similar type. Antifungals can sometimes be referred to as a fungicide. And clotrimazole is a common antifungal you can find in your pharmacy. I have a rash on my feet. Could you recommend an antifungal cream, please? I have a fungal infection under my arm. Could you suggest an antifungal suitable for that area? An antiseptic can be used to disinfect cuts and wounds, and they can also be referred to as disinfectants or germicides. Hydrogen peroxide and iodine are common antiseptics. I cut myself. Is an antiseptic like hydrogen peroxide suitable, and how should I use it on the wound? I burnt myself last night on the stove. Could you suggest a mild antiseptic? Our 12th and final medication type is motion sickness medication. These medications help prevent and relieve motion sickness. Motion sickness is having symptoms such as dizziness, nausea, and vomiting while traveling. Common options for motion sickness medication include dimenhydrinate and mescalzine. Can you recommend a motion sickness medication, and when should I take it before traveling? I get very sick when I'm a passenger in the car. Which medication is best for motion sickness? Today, and in this lesson we'll be delving into the world of the pharmaceutical industry. If you're new to this field, you're in the right place. We'll be exploring 15 essential terms with more detailed definitions to get you started. If you're ready, let's jump right in. The pharmaceutical industry is a vast sector responsible for researching, developing, manufacturing, and distributing medications that improve human health and well-being. We also have the term pharma, which is a commonly used abbreviation of the word pharmaceutical. This term is often used informally to describe the entire pharmaceutical field and is frequently used in discussions and news related to the industry. Let's take a closer look at this word medication. A medication is a substance used for medical treatment, such as pills, capsules, or syrups. Medications can treat a wide range of conditions, from pain relief to chronic diseases. With this industry, you'll hear a lot about drug discovery. This is the intricate process of identifying and designing new medications through research and experimentation. This includes the initial identification of potential compounds to extensive laboratory testing. Clinical trials are carefully designed experiments to test the safety and efficacy of new drugs before they are approved for use. These trials involve multiple phases and help determine whether a drug is safe and effective. Let's Let's move on to our next bit of terminology, which is prescription drug. A prescription drug is a medication that can only be obtained with a doctor's written order. They are typically used for serious medical conditions and require professional guidance. There is also over-the-counter medication, which is available without a prescription and can be purchased directly from a pharmacy or store. These are generally for common self-treatable ailments. Another type of medication you'll hear about is a vaccine. A vaccine is a substance that stimulates the immune system to protect against specific diseases. Vaccines have been instrumental in preventing and controlling infectious diseases like polio and measles. Drug regulatory authorities are responsible for ensuring the safety and effectiveness of drugs. They review and approve medications before they reach the market. And on screen for you, you can see a selection of these authorities from different English-speaking countries. Probably the most widely known of these would be the FDA in the United States. A pharmaceutical company is an organization that researches, develops, and manufactures medications. These companies range from small research-focused firms to large global corporations. A generic drug is a medication that is equivalent to a brand name drug, but is usually more affordable. They contain the same active ingredients and meet the same quality standards. The term biotechnology involves using living organisms and biological systems to develop new drugs and treatments. This field has led to the creation of therapies like biologic drugs. Clinical data refers to information gathered during clinical trials, helping to assess a drug's effectiveness. It includes data on patient demographics, safety, efficacy, and adverse reactions. Adverse reactions are more commonly known as side effects. These are unintended and often unwanted effects of a medication, which may happen in addition to its intended effects. Understanding potential side effects is crucial for safe medication use. A placebo is a substance with no therapeutic effect. It is used in clinical trials as a control to compare with the effects of the drug being tested. Placebos help researchers assess the true impact of a medication. Pharmacovigilance is the science and activities related to the detection, assessment, understanding, and prevention of adverse effects or any other drug-related issues. It plays a key role in ensuring medication safety even after a drug is on the market. In this English lesson, you will learn phrases for the pharmacy. This lesson is broken down into 5 different categories, so you'll definitely learn lots of useful English. So let's get started, and our first category is prescription medication. Can I have my prescription filled here? Can I have my prescription filled here? How should I take this medication? How should I take this medication? What are the side effects of this drug? What are the side effects of this drug? Is this medication safe with my allergies? Is this medication safe with my allergies? Can I get a refill on this prescription? Can I get a refill on this prescription? What should I do if I miss a dose? What should I do if I miss a dose? In our next category, we will ask questions about over-the-counter medication. What is a good remedy for a headache? What is a good remedy for a headache? Do you have something for cold symptoms? Do you have something for cold symptoms? Can you recommend an allergy relief medicine? Can you recommend an allergy relief medicine? Is there an over-the-counter drug for coughs? Is there an over-the-counter drug for coughs? What should I take for stomach pain? What should I take for stomach pain? Do you have any natural supplements? Do you have any natural supplements? Our third set of phrases and questions relate to general health queries. What vitamins should I take for better health? What vitamins should I take for better health? Do you have sunscreen for sensitive skin? Do you have sunscreen for sensitive skin? What are the best products for skincare? What are the best products for skincare? Can you suggest a good pain reliever? Can you suggest a good pain reliever? Which product is best for wound healing? Which product is best for wound healing? How do I check my blood pressure? How do I check my blood pressure? Let's move on to our fourth category, which is queries about pharmacy services. Do you offer flu shots here? Do you offer flu shots here? Can I schedule a health checkup? Can I schedule a health checkup? Is there a pharmacist available for consultation? Is there a pharmacist available for consultation? Can I get travel vaccinations here? Can I get travel vaccinations here? Do you provide medicine home delivery? Do you provide medicine home delivery? Are there any health screenings available? Are there any health screenings available? Our last category deals with phrases relating to specific conditions. What's best for managing diabetes? What's best for managing diabetes? Can you recommend something for arthritis pain? Can you recommend something for arthritis pain? What do you have for heartburn relief? What do you have for heartburn relief? Is there an effective treatment for insomnia? Is there an effective treatment for insomnia? What options are there for high blood pressure? What options are there for high blood pressure? Do you have products for asthma relief? Do you have products for asthma relief? Get ready to learn lots of new English vocabulary on pregnancy. Let's take a look at our lesson plan for this video. In this lesson, you will learn lots of key vocabulary, and you'll learn the pronunciation and meaning of each word. And you'll understand the context of these words with lots of example sentences. I don't know about you, but I'm ready to start this lesson. Sit back, relax, grab a pen and paper, and let's learn some English together right now. Our first word marks the very beginning of our journey. The egg. Repeat after me. Egg. The egg is the female sex cell. Let's move on and take a look at the male sex cell. Sperm. Repeat after me. Sperm. The moment the two sex cells come together in intercourse is called conception. Repeat after me. Conception. After conception and for the first 2 weeks, we call the baby at this stage a zygote. Repeat after me. Zygote. After the first 2 weeks and until the 8th week, we call the baby an embryo. Repeat after me. Embryo. After the 8th week and until birth, the baby is referred to as the fetus. Repeat after me. Fetus. The baby is connected to the mother by the umbilical cord. Repeat after me. Umbilical cord. And the baby is fed through the placenta. Repeat after me. Placenta. When a person is carrying a baby, we say that they are pregnant. Repeat after me. Pregnant. Let's take a look at our first simple example sentence. She is pregnant. She is pregnant. A common idiom we use to describe pregnant women is expecting a baby. Expecting a baby. Let's take a look at this idiom in an example sentence. She is expecting a baby. She is expecting a baby. And there is a similar idiom, having a baby. Having a baby. You could say, she is having a baby. She is having a baby. A lot of people discover they are pregnant by using a pregnancy test. Repeat after me. Pregnancy test. Some people have difficulty conceiving naturally, they may use in vitro fertilization. This is more commonly known as IVF. Repeat after me. IVF. Another method used by couples who are experiencing difficulty having a baby is surrogacy. Let's take a look at the definition. Surrogacy is an arrangement often supported by a legal agreement whereby a woman agrees to bear a child for another person or persons who will become the child's parent after birth. The embryo or baby is implanted in the uterus of the surrogate mother who carries the baby until birth. So the surrogate is the person who carries the baby for another couple or person. An example sentence is, they are having a baby by surrogacy. They are having a baby by surrogacy. If this is your first time visiting my channel Learning English Pro, you're very welcome. My name is Jer and I hope you're really enjoying this lesson. Please take the time to like this video and subscribe to my YouTube channel. Coming up next in our vocabulary, we'll be taking a look at the symptoms of pregnancy. A symptom which is commonly referred to in English-speaking culture is morning sickness. Repeat after me. Morning sickness. This can also be called nausea. Repeat after me. Nausea. Another symptom of pregnancy is fatigue. Repeat after me. Fatigue. This could also be called tiredness. Another symptom which may be experienced is swollen breasts. Swollen breasts. And just when you think it couldn't get any worse, women can also suffer from increased urination. Increased urination. As the baby grows in a woman's belly, we call the bigger area the baby bump. Repeat after me. Baby bump. And with a baby bump comes the need for new clothing. The clothing that is needed for pregnant women is called maternity wear or maternity clothing. If you were looking in a store, you could say, "Do you have maternity wear in this store?" Another aspect for a growing stomach in pregnancy is stretch marks. Repeat after me. Stretch marks. And it is quite common to use some form of skin lotion to help combat the appearance of stretch marks. The duration of a pregnancy is usually 40 weeks or 9 months. And the day a baby is expected is called the due date. Due date. As the due date approaches, a woman may experience labour. These are the pains and discomfort that come along when the baby is arriving. Labour. We would say, she is in labour. She is in labour. A nurse which helps mothers in this time is called a midwife. Repeat after me. Midwife. And the event of a baby's arrival is called the birth. Repeat after me. Birth. So very shortly in the video, we'll be seeing some live footage of a birth. So if you're a bit squeamish, skip ahead about 50 seconds and you should miss it. When a baby is born without any medical intervention, it is called a natural birth. Natural birth. Sometimes babies will be born through a surgical method called a caesarean section. Repeat after me. Caesarean section. This is often shortened to just C-section. C-section. Or it may be called a caesarean birth. One more time. Caesarean birth. Also commonly used is a local anesthetic during the birth process. This is more commonly known as an epidural. Repeat after me. Epidural. And can you believe it's our last word and the result of a pregnancy? Newborn. Repeat after me. Newborn. In today's video, we're delving into the world of prescription medication. Prescription drugs are a critical part of healthcare, and understanding them is essential for informed decision making. Let's start our video with our main topic, prescription medication. These are medications that require a doctor's prescription for purchase or a doctor's permission. They are often used for treating specific medical conditions, and these types of medications are regulated to ensure safe and effective use. The prescription itself is actually the piece of paper where the doctor's orders are written on. And you're going to take this piece of paper, the prescription, to a pharmacist. This is the healthcare professional who dispenses prescription medications and provides guidance on their use. They play a vital role in patient care and can offer you lots of advice. When you get a prescription, you will also get information and instructions relating to dosage. Dosage refers to the amount and frequency of a medication prescribed by a healthcare provider, so how much you can take and when you can take it. It's crucial to follow the recommended dosage for safe and effective treatment. Side effects are unintended effects of medication, which may happen in addition to its intended effects. So this means that you might feel a bit sick from taking medication. Understanding potential side effects is important for patient safety, and as a patient, if you suffer from any side effects while taking medication, it's important to contact your doctor or your pharmacist. When it comes to picking the type of medication, there are two types. The first we'll look at is generic medication. This is an affordable equivalent to a brand name drug containing the same ingredients. It provides cost-effective options for patients. Now, this term which I've just mentioned, brand name medication, means the original version of a drug developed by a pharmaceutical company. It's often more expensive than generic alternatives. If you are unable for some reason to get prescription medication, you might be able to use over-the-counter medication. This is available without a prescription and can be purchased directly from a pharmacy or a store like a supermarket sometimes. These are typically used for common self-treatable illnesses and ailments. Our next term is drug interactions. These happen when one medication affects the action of another, so these can happen to people who have to take lots of different types of medications. Understanding potential interactions is really crucial to avoid adverse effects. Adverse reactions or adverse effects are unexpected and harmful effects caused by medication. They're like really extreme side effects. They can range from mild to severe and require immediate medical attention. A prescription refill allows patients to obtain additional doses of their prescribed medication. It's essential to follow refill instructions and schedules. Depending on the country, you can sometimes ring your pharmacist for a prescription refill, or you may need to contact your doctor. Next up, we're going to have a look at two different organizations, the FDA in the United States and the MHRA in the United Kingdom. These are drug regulatory authorities responsible for ensuring the safety and effectiveness of prescription drugs. The medication label provides important information about a prescription drug. This can include dosing instructions, side effects, and usage precautions. When you receive your prescription medication, it generally comes with a patient information leaflet. This document offers comprehensive information about the drug, its effects and safety guidelines. It's a good idea to give it a read over before you take your prescription medication for the first time. Something which will be clearly marked on your medication is its prescription expiration date. This indicates when a prescription medication should no longer be used. It's important to adhere to this date for safety. An important thing to remember for anyone taking prescription medication is medication adherence. This is the practice of taking prescription drugs as directed by a healthcare provider, like a doctor, nurse, or pharmacist, and this helps you to achieve the intended therapeutic effect. Today, we're delving into the captivating world of psychology, exploring essential psychological terms. Whether you're a psychology student or just curious about the human mind, this video is for you. And as usual, all the terms covered in today's lesson are available for you in the video description if you want to follow along or revise after the lesson. So let's get started with our first term, which is the topic of our lesson, psychology. Psychology is the scientific study of the human mind and behavior. It seeks to understand and explain our thoughts, feelings, and actions. Psychology. Next up, we have the word behavior, which has different spellings in American and British English. Behavior encompasses all actions and reactions of an individual or organism, from simple reflexes to complex interactions. Behavior. Now let's explore cognition. Cognition refers to mental processes such as perception, thinking, reasoning, and problem solving. Repeat after me. Cognition. Emotion is our next term. Emotions are complex psychological and physiological responses to events or situations, involving feelings like joy, fear, anger, and more. Emotion. Moving on to memory. Memory is the ability to store, retain, and recall information and experiences. Memory. Consciousness is the awareness of one's thoughts, feelings, and surroundings at any given moment. Consciousness. Next, we have perception. Perception is the process of interpreting sensory information to understand and make sense of the world. Perception. Stress is a psychological and physiological response to challenging situations, often leading to feelings of tension or anxiety. Stress. Now, motivation. Motivation is the internal or external drive that initiates, directs, and sustains behavior towards a goal. Motivation. Personality is a unique set of enduring characteristics, behaviors, and traits that define an individual. Personality. Moving on to intelligence. Intelligence is the capacity to learn, reason, and solve problems effectively. Intelligence. Our next term is abnormal psychology. This is the study of atypical behaviors and psychological disorders, aiming to understand and treat them. Abnormal psychology. Therapy refers to the various treatments and interventions used by psychologists and mental health professionals to help individuals improve their psychological well-being. Therapy. Our next term is social psychology. This focuses on how individuals are influenced by social interactions and the impacts of groups on behavior and attitudes. Social psychology. We also have developmental psychology. This type of psychology examines the psychological growth and changes that happen from infancy to old age. Developmental psychology. The word I've already mentioned is anxiety. Anxiety is a state of uneasiness or worry, often accompanied by physical symptoms such as increased heart rate and restlessness. Repeat after me. Anxiety. Depression is a mood disorder characterized by persistent sadness and a loss of interest or pleasure in activities. Depression. The term self-esteem means an individual's overall evaluation of their self-worth and self-perception. Self-esteem. Schizophrenia is a severe mental disorder characterized by disorganized thinking, hallucinations, and a loss of contact with reality. Repeat after me. Schizophrenia. Psychotherapy is a form of treatment involving psychological techniques and talking to a trained therapist to address emotional and mental health issues. Psychotherapy. Today we're delving into crucial English vocabulary relating to medical surgery. This video is really useful for healthcare professionals and for those going for surgery. As this video covers medical surgery, there will be some images and videos of actual surgery, so bear that in mind as you're watching the lesson. So with all of that business out of the way, let's get to it. Our first word is surgeon. A surgeon is a highly skilled medical professional specializing in performing surgical procedures. Surgeons undergo extensive training to acquire the expertise needed to operate on patients, addressing various medical conditions. They play a pivotal role in healthcare, working with precision and care to ensure the best possible outcomes for their patients. Anesthesia is a medical practice involving the administration of medications to induce a reversible loss of sensation or consciousness. It is a crucial aspect of surgery, ensuring that patients remain pain-free and unaware during the procedure. An anesthesiologist is a specialized medical doctor responsible for providing anesthesia and monitoring the patient's vital signs during surgery. They play a critical role in ensuring the patient's safety and comfort throughout the entire surgical process. It's important to note that there are two different types of anesthesia. General anesthesia, which involves inducing a state of controlled unconsciousness in a patient, or local anesthesia. This is a technique used to numb a specific part of the body, allowing the patient to remain conscious during surgery while preventing pain in the targeted area. This is the type of anesthesia you'll get at your dentist. Next up, we have the scalpel. This is a precision surgical instrument with a small, sharp blade used by surgeons to make precise incisions during medical procedures. The design of the scalpel allows for controlled and accurate cutting, minimizing tissue damage and facilitating the surgeon's ability to navigate delicate anatomical structures. And the word incision refers to the deliberate cut made with the scalpel to access a specific area of the body during a medical procedure. The size and location of the incision depend on the nature of the surgery, and skilled surgeons take great care to make incisions that promote optimal healing and minimize scarring. The incision site is the specific area on the patient's body where the surgical incision is made. Proper preparation and care are taken to ensure the cleanliness and sterilization of the incision site before surgery, and this helps to prevent infections and promote a smooth healing process. Sutures are stitches or materials used by surgeons to sew the edges of an incision together after a surgical procedure. Suture is also a verb. You can suture a wound. The materials used for a suture vary in composition, and the choice of suture depends on factors such as type of surgery, the location of the incision, and the desired outcome of the wound healing process. Preoperative is a term that refers to the period before surgery, when medical professionals conduct assessments, prepare the patient, and provide necessary information about the upcoming procedure. This phase includes obtaining informed consent, which we'll discuss in a moment, conducting medical tests, and ensuring the patient is physically and mentally ready for surgery. Post-operative encompasses the period after surgery, focusing on the patient's recovery and the monitoring of any potential complications. Medical professionals closely observe patients in the post-operative phase, providing necessary care, pain management, and guidance on post-surgical activities to promote a smooth and successful recovery. The operating room, often referred to as the OR, is a specially designed and sterile environment where surgical procedures take place. Equipped with advanced medical technology, the operating room provides surgeons with the necessary tools and resources to perform surgeries safely and efficiently. On the other hand, we have the recovery room. This is the designated space where patients awaken from the effects of anesthesia after surgery. In this area, medical professionals closely monitor patients as they regain consciousness, ensuring a smooth transition from the surgical environment and addressing any immediate post-operative needs. Informed consent is a formal agreement given by the patient after understanding the details, risks, and benefits of a proposed surgical procedure. It is a crucial ethical and legal aspect of medical practice, ensuring that patients are well informed and actively participate in decisions regarding their healthcare. Our next term is hemostasis. This is the physiological process of stopping bleeding or controlling bleeding flow during surgery. Surgeons employ various techniques such as sutures, cauterization, and the use of hemostatic agents to achieve hemostasis and prevent excessive bleeding, promoting a safe and successful surgical outcome. If you are a medical professional learning English, or perhaps you're just curious in the topic, you should head over to my channel, Learning English Pro, where I have lots and lots of medical vocabularies waiting for you. And I have lots of them linked on screen and linked in the video description below, so check those out after the video and really boost your medical English vocabulary. Now it's time to take the vocabulary we've just learned and make some really great English phrases for them. I'll say each sentence twice and give you a chance to say it after me. Don't worry if you fall behind, just press pause. Let's start with our first phrase. I understand the risks and give my informed consent for the surgery. Listen to the sentence again and then repeat after me. I understand the risks and give my informed consent for the surgery. Okay, let's move on to our next sentence. The anesthesiologist will discuss the type of anesthesia you'll receive. The anesthesiologist will discuss the type of anesthesia you'll receive. The surgeon will make an incision in this area. Repeat after me. The surgeon will make an incision in this area. Our next sentence is, the operation will take place in the operating room. The operation will take place in the operating room. You'll be under general anesthesia during the surgery. You'll be under general anesthesia during the surgery. Please prepare the patient for surgery in the preoperative area. Please prepare the patient for surgery in the preoperative area. The incision site will be cleaned and sterilized before the procedure. Repeat after me. The incision site will be cleaned and sterilized before the procedure. The nurse will assist in suturing the wound post-surgery. The nurse will assist in suturing the wound post-surgery. The recovery room is where you'll wake up after the operation. Repeat after me. The recovery room is where you'll wake up after the operation. The surgeon will ensure proper hemostasis to control bleeding during the procedure. The surgeon will ensure proper hemostasis to control bleeding during the procedure. Today, we're delving into the diverse world of medical procedures, exploring various types of surgeries. Now, a word of warning. In this lesson, you will see scenes of surgeries and human anatomy. Some scenes are not for the squeamish, so please bear that in mind as we embark on our lesson. So let's get started, and this promises to be quite a difficult lesson for English pronunciation, so we're going to take some of the words quite slowly. Laparoscopy is our first type of surgery. This is a minimally invasive surgical procedure that involves making small incisions in the abdomen to insert a camera and specialized tools. This technique allows surgeons to view and operate on internal organs with less trauma and a faster recovery time compared to traditional open surgery. So let's try this word one more time. Laparoscopy. A cholecystectomy is the surgical removal of the gallbladder, commonly performed to treat gallstones or other gallbladder-related conditions. The procedure can be done through traditional open surgery or with laparoscopy. Let's check our pronunciation one more time. Cholecystectomy. Our next surgery type is a bit easier to pronounce. Vascular surgery. This focuses on treating conditions affecting the blood vessels, such as arteries and veins. Surgeons in this field address issues like aneurysms, blockages, and vascular malformations, employing both open and minimally invasive techniques. Vascular surgery. Our next term is appendectomy. This is the surgical removal of the appendix, often necessary when it becomes inflamed or infected, a condition known as appendicitis. This procedure is typically performed urgently to prevent complications. Repeat after me. Appendectomy. A hysterectomy involves the surgical removal of the uterus and sometimes the cervix. This procedure is performed for various reasons, including treating conditions such as uterine cancer, fibroids, or severe endometriosis. Hysterectomy. And our next surgery type is endoscopy. Endoscopy is a diagnostic or therapeutic procedure that uses a flexible tube with a light and camera to visualize the interior of organs or cavities. It is valuable for detecting abnormalities and performing minimally invasive interventions. Endoscopy. A hysteroscopy is a procedure that involves the insertion of a thin, lighted tube into the uterus to examine and treat conditions affecting the uterine lining, such as abnormal bleeding or polyps. Repeat after me. Hysteroscopy. Our next surgery type is gastric bypass surgery. This is a weight loss procedure that involves rerouting the digestive system to create a smaller stomach pouch. This restricts the amount of food intake and promotes weight loss, often recommended for individuals with severe obesity. Gastric bypass surgery. Cataract surgery is a common procedure to remove a cloudy lens from the eye and replace it with an artificial lens. This surgery improves vision and is often performed as an outpatient procedure. Cataract surgery. Let's move on to coronary artery bypass surgery. This is a cardiac procedure that addresses blocked or narrowed coronary arteries. Surgeons use grafts to create new pathways for blood flow, restoring blood supply to the heart muscle. Coronary artery bypass surgery. A hip replacement involves replacing a damaged or diseased hip joint with an artificial implant. This surgical intervention is common for individuals experiencing hip arthritis or severe joint damage. Hip replacement. A tonsillectomy is the surgical removal of the tonsils, often performed to address recurrent tonsillitis or other throat-related issues. The procedure is more common in children, but can be performed at any age. Repeat after me. Tonsillectomy. Our next surgical term is a bit tricky. Carotid endarterectomy. This is a surgical procedure to remove plaque or blockages from the carotid arteries, which supply blood to the brain. This helps prevent strokes to improve blood flow. Carotid endarterectomy. A caesarean section or C-section is a surgical delivery method in which a baby is delivered through an incision made in the mother's abdominal and uterine walls. It is performed when a vaginal delivery poses a risk to the mother or baby. Caesarean section or C-section. A breast biopsy is a diagnostic procedure involving the removal of a sample of breast tissue for examination. It helps in determining the presence of cancer or other breast abnormalities. Breast biopsy. Fancy learning English like a pro and testing your advanced English skills? Well, head over to the community tab on my page and test yourself in the Learning English Pro Advanced English Quiz. Every day you can test your English vocabulary knowledge with a tricky question. And in the community tab, you'll also see lots of additional Learning English Pro learning content. Cystoscopy is a procedure that involves using a thin tube with a camera to examine the interior of the bladder and urethra. It aids in diagnosing and treating various urinary tract conditions. Repeat after me. Cystoscopy. Bronchoscopy is a diagnostic procedure that allows the visualization of the airways and lungs using a thin, flexible tube with a light and camera. It is used to detect and treat respiratory conditions. Bronchoscopy. Our next surgical term is probably the longest word I've ever encountered doing Learning English Pro videos. But if you break it down bit by bit, it's actually quite easy to say. Let's try it slowly first. Esophago-gastro-duodenoscopy. Let's do it one more time. Esophago-gastro-duodenoscopy. It can also be shortened to EGD, which is probably a better way to go about it. EGD is a procedure that involves the insertion of a flexible tube into the esophagus, stomach, and duodenum. It is commonly used to diagnose and treat conditions affecting the upper gastrointestinal tract. So let's try that big long word one more time. Esophago-gastro-duodenoscopy. A radical mastectomy is an extensive surgical procedure for breast cancer involving the removal of the entire breast, underlying chest muscles, and lymph nodes. Modern approaches often favor less invasive techniques when appropriate. Radical mastectomy. A vasectomy is a surgical procedure for male sterilization, involving the cutting or sealing of the tubes that carry sperm from the testicles. This results in the prevention of sperm from reaching semen, making a man unable to father children. Vasectomies are a safe and effective method of permanent contraception and are done as an outpatient procedure. Vasectomy. And that wraps up our English Masterclass on medical terms and phrases. Well done if you stuck out through the entire video. You've learned a tremendous amount of medical English by watching this video. Make sure to share it with friends and colleagues who might benefit from watching these lessons. And don't forget to subscribe to Learning English Pro. I publish new medical English lessons all the time.